Good afternoon, everyone. Welcome back. Good afternoon, colleagues, and thanks to our speakers today. We have a full afternoon. I do want to say to our speakers, I know for some of you, this is your first time before the council. We have a very full agenda today, and unlike other jurisdictions, we meet year-round. So my colleagues are always free to, but they may be unlikely to ask questions today about your testimony because we want to reserve all the time possible for you. We have plenty of time for back and forth during committee work sessions and full council debates. So please don't infer any lack of interest in the subject matter if my colleagues don't have questions today. It's just that our operational culture and our schedule is different than what you might be used to in Annapolis or DC or elsewhere. So I hope that makes sense. We are very interested in all the testimony we're going to hear today. Item 5 is a public hearing on Bill 3521, Prevailing Wage Requirements, Construction Contracts Amendments. The bill would amend definitions related to construction and prevailing wage thresholds, adopt the state prevailing wage law regarding the contract threshold limit, apply prevailing wage requirements to certain public-private partnerships, require construction contracts to include local hiring requirements, specify violations of the local hiring mandate, authorize the department to adopt regulations, and generally amend the law regarding applicability to prevailing wage requirements. And a GO committee work session will be scheduled at a later date. Persons wishing to submit additional material for our consideration should do so before the close of business on November 9th. Ms. Kennedy, could you please call on the first speaker?
Yes, good afternoon. Our first speaker today is T. Smalls. Mr. Smalls, you have 2 minutes for your testimony and you may begin as soon as you're ready.
All right, I will keep it as brief as possible.
You have 2 minutes. We're glad you're here.
Thanks for having me.
Take all the time.
Yep. My name's T. Smalls. Like was mentioned earlier, I'm the business manager and financial secretary of Plumbers and Gas Fitters, local number 5 in DC. And we're this bill 3521, mechanical services contract agreement amendment as well. I serve and I cover over 2,000 members between journeymen, mechanics, apprentices, retirees, and but this particular bill, as it pertains to prevailing wage, is super important to the livelihood of our members and the growth of our local, and us increasing the training and the wage and benefit packages that we provide to our members. We accept membership from all different walks of life. We accept membership from anyone who is interested in learning the skill, the trade, and growing in the trade. But as it pertains to the amendment to this particular bill, it's super important that's taken a look at on the service side, because one thing we try to do is grow through our members becoming business owners. And right now, there's a lot of service work that's being done in the area, and we try to have different things in place that will provide them an opportunity for a fair playing field and being owners and all that type of stuff. So not to rattle on too far, I know you're on a schedule. I just want to thank you for your time and ask that you support this bill 3521 with the mechanical service contract amendment.
Thank you, Mr. Smalls. Our next speaker today is Yudmi Carroll.
And
Yudmi?
Ms. Kennedy, if you could remind everyone, all the speakers should feel free to turn on their video.
Yes, that would be great. If people have their video, please turn it on for us so we can see your face. Ms. Carroll, you have 2 minutes for your testimony and you may begin when you're ready.
Can you hear me?
We can.
Well, thank you again for this opportunity. And like you mentioned, my name is Yumi Carroll. I'm a member of Local 602 Steam Fitters. I'm also a member of the women's group that our local has provided for us. And as a member of this local and organization, I definitely support this new law that the Toronto guys passed, as we see how important it is for us, for our industry. And it'll be helpful for the local to have more jobs and also training opportunities for other women, not only women, but everybody in our field. And I don't know, is there any other questions that I should answer? But that's all I have to say.
Thank you for your testimony, Ms. Carroll. Our next speaker today is Tom Bello. Mr. Bello, you also have 2 minutes. You may begin.
Sorry, I'm trying to start my video. There you go. Okay.
There you go. There you go. Great.
Good afternoon, members of the council. My name is Thomas Bello. I'm the Executive Vice President of the Mechanical Contractors Association of Metro Washington, MCAMW for short. We represent approximately 180 mechanical contracting firms within the Washington metro area. We strongly support Bill 3521, inclusive of the Mechanical Service Contract Amendment. The contractors of the MCAMW represent, they employ approximately 10,000 men and women within our region and collectively employ approximately 1,000 working apprentices. The companies that embody the MCAMW range from 1 to 2 person operations to 1,500 plus employees. Our economic footprint within the region is quite substantial. We generate approximately $2 billion in annual revenue, contribute, pay about $500 million in local, state, and federal taxes per year. We're in support of Bill 3521 because our contractor members make a moral choice to pay their employees fair wages, which provide better outcomes for their employees and their communities. Our contractor members take pride in the fact that their workforce is the best trained, the best skilled, and the safest workforce in the state of Maryland. The MCAMW is dedicated to rising the tide that lifts all of these ships, and prevailing wage and Davis-Bacon provide that pathway to create better paying jobs, financial security, and opportunities for our workforce to provide a secure future for their families. In partnership with T-Smalls and Steamfitters Local 602, the MCAMW is dedicated to creating pipelines for the next generation of skilled tradesmen and women by working with our local high school, CTE, faculty, and staff to support summer internships, pre-apprentice programs, full-time employment opportunities for those students upon graduation. And by lowering the prevailing wage thresholds, aligning with state requirements, implementation of local hiring requirements, and including that service contract amendment into this legislation, this ensures that careers in the skilled trades have a secure future for the next generations to come.
Mr. Bello, your time is up. Thank you
Okay.
very much.
Thank you, Tom.
Thank you for your testimony. Our next speaker today is Jonathan Bolden. Mr. Bolden, you also have 2 minutes and you may begin your testimony as soon as you're ready.
Good morning. My name is Jonathan Bolden. I'm from RSC Electrical and Mechanical Contractors. I'm a certified minority business enterprise in the state of Maryland. I am also a member of Steamfitters Local 602 and Plumbers Local 5. I support this bill. This bill will also help out-of-state contractors, low bidding projects. It can also enhance other minority contractors to become union contractors. And we can have a benefit of this bill, which can also be a give back to the community from the MBE business enterprise. Thank you.
Thank you, Mr. Bolden. Our next speaker today is Chris Modello. Mr. Modello, you may begin when you're ready and you have 2 minutes for your testimony.
Good afternoon. Thank you for the opportunity. My name is Chris Modello, and I'm the business manager and financial secretary treasurer of Steamfitters Local 602, and we strongly support Bill number 3521 and Mechanical Service Contract Amendment. We represent over 5,000 men and women and apprentices, but we feel that this isn't just about our members. Our local union, through our apprenticeship program, offers men and women in Montgomery County and throughout the Washington, D.C. metropolitan area an opportunity to a great life. To begin a career working full-time, making $50,000 a year, and to attend school in the evenings, so it does not interrupt their ability to earn for themselves and their families. When these men and women successfully complete their on-the-job and in the classroom training, they advance in pay and benefits every 6 months. Once they complete the program, they will earn over $100,000 a year and over $50,000 a year in tax-free medical and retirement benefits, and this will increase annually. This allows them not only the opportunity to advance in pay and to earn great medical and pension and retirement savings benefits, it will allow them to do so without any debt and not have any income or medical worries when they retire. And we offer this to everyone, no matter where you came from, no matter what you look like, how old you are, and what your past may have been. The only thing that matters to us is that people need an opportunity to get ahead in life. And it is great that we offer these things to so many people. It is great that we can help change people's lives with these lifelong opportunities. We take pride in it, but we want to offer more. And we feel like this legislation will give us the ability to offer more working men and women an opportunity to get ahead in life. So we strongly support this bill and the amendment for the mechanical service contractors. And, I imagine that our goal is the same as yours, to help people. So we appreciate your time and consideration.
Thank you, Mr. Mandello. Our next speaker today is Darwin Bonilla. Mr. Bonilla, you have 2 minutes for your testimony. You may begin when you're ready.
Good afternoon, Chair Navarro and County Council members. My name is Darwin Bonilla. I am a Montgomery County resident since I immigrated to the United States from El Salvador in 1998. I went through the Steamfitters Local 602 apprenticeship program, and I am now the Director of Organizing for the Mid-Atlantic White Trades Association, representing 7 local unions, 400 contractors, and over 8,500 skilled workers. Because of the opportunities that I have been given, my life centers in giving back to the community and extending those opportunities to thousands of young workers. This includes people of every race, gender, and background, including men and women who have come to us throughout reentry programs. Please support Bill 3521 with the Mechanical Service Contract Amendment so that we can provide even more jobs and opportunities to our young women and men. Thank you. Buenas tardes, Presidenta Navarro. Mi nombre es Darwin Bonilla, soy residente del condado de Montgomery desde que emigré a los Estados Unidos de El Salvador en 1998. Participé en el programa de aprendizaje de Steamfitters Local 602. Ahora soy el director de organización del Mid-Atlantic White Trades Association, representando 7 sindicatos, 400 contratistas y más de 8,500 trabajadores calificados. Gracias a las oportunidades que he recibido, mi vida se centra en retribuir a la comunidad y extender esas oportunidades a miles de trabajadores jóvenes. Estos incluyen personas de todas razas, géneros y orígenes, incluidos muchos hombres y mujeres que han venido a nosotros a través de programas de reingreso. Por favor, apoye el proyecto de ley 3521 con la enmienda del contrato de servicio mecánico para que podamos proporcionar aún más empleos y oportunidades a nuestras y nuestros jóvenes. Muchas gracias.
Thank you for your testimony, sir. Our next speaker today is Victoria Leonard. Miss Leonard, you have 2 minutes for your testimony, and you may begin when you're ready.
Thank you for the opportunity to testify today on Bill 3521. My name is Victoria Leonard, and I'm the Political and Legislative Director of the Baltimore-Washington Laborers District Council. We are an affiliate of the Laborers International Union of North America, or LIUNA for short, and the District Council has 7,500 members in this area. And on behalf of LIUNA, I want to thank you so much for introducing this bill and with such wide support. A special thanks to Council President Hucker and Councilmember Jawando for working together as lead sponsors, and a shout out as well to co-sponsors, Council members Rice, Glass, Albornoz, Katz, and Reamer. We at LIUNA feel this is a great moment in Montgomery County, and we at LIUNA support this bill because it brings the county's prevailing wage threshold into line with the state's. We also support the bill because it has a broader definition of construction. And we finally support this bill because it champions local hiring. However, LIUNA would like to suggest 2 important ways to strengthen the bill. Number 1, we feel that projects receiving economic development subsidies need to be more holistically addressed in the bill. Baltimore County, which passed its prevailing wage law in 2020, and Anne Arundel County, which passed its law just last month, both cover subsidized projects receiving more than $5 million in county funds. And so we at LiUNA hope that Montgomery County will be able to do the same or even better. And number two, the process for implementing the local hiring provision needs to be spelled out in Bill 3521 rather than leaving it up to the county government to adopt regulations. Both Baltimore County and Anne Arundel County prevailing wage laws provide good examples for this. And so in closing, we at LiUNA appreciate the council for taking on the effort to update the county's prevailing wage law, and we look forward to working with you on finalizing this bill. Thank you.
Thank you, Ms. Leonard. Our next speaker today will be Stephen Courtien. Mr. Courtien, you have 2 minutes for your testimony, and you may begin when you're ready.
Thank you very much. My name is Stephen Courtien. I'm the president of the Baltimore DC Metro Building Trades Council. We're the local affiliate organization for the North America's Building Trades Unions. We support the 23 construction unions in the greater Baltimore, DC, Northern Virginia region. Combined, we represent more than 26,000 skilled construction workers in the building and construction industry. I would like to thank the Council President Hucker and Councilmember Jawando for introducing this bill and for the council members who co-sponsored it. We enthusiastically support lowering the county prevailing wage threshold to $250,000. We also support expanding the definition of construction to include routine operation, repair, and ongoing maintenance. These changes will help a broader array of construction workers receive family supporting wages and will level the playing field for contractors. We also support local hiring because taxpayers' dollars should create jobs for local residents. On behalf of the building trades, we do believe that Bill 3521 could be strengthened by more comprehensively addressing economic development projects receiving county subsidies. As drafted in Bill 3521 applies to P3s, in which the county invests $5 million or more, with the exception to affordable housing projects. However, the bill as drafted does not include pilots, although that is a typical subsidy the county offers to private developers, most recently to those who developed on WMATA property. The building trade suggests amending the bill to cover pilots. We also suggest that the bill be amended to cover TIFs in addition to the P3s, in case the county ever does adopt this tool. Baltimore County's prevailing wage laws includes TIFs, pilots, and P3s, valued at more than $5 million. So the precedence does exist. Thank you very much for the opportunity to testify.
Thank you, Mr. Courtien. I see that Mr. McGill is here, so our next speaker will be George McGill. Mr. McGill, you'll have 2 minutes for your testimony. You may begin. Mr. McGill, are you there? Okay, he is still muted. There might be some problems with his microphone. So we will move to Lori Craig. Lori, you have 2 minutes for your testimony, and you may begin when you're ready.
Hi, good morning. I am going to read from my prepared response. Thank you for the opportunity to testify on Bill 3521. My name is Lori Craig. I am the owner of Craig Electric, located in Rockville, Maryland, in District 4. My husband, Kevin, and I have 5 employees. We have been in the electrical contracting business for more than 21 years. Our specialty is control wiring, and we have worked on many construction projects across our region. Craig Electric supports Bill 3521. We support lowering the county's prevailing wage threshold to the state's current level of $250,000. We support expanding prevailing wage to include routine operation, repair, and maintenance. We support expanding prevailing wage to cover development projects that receive subsidies from the county. As a construction contractor, these adjustments to the county's prevailing wage law would be very helpful for several reasons. First, By broadening the coverage of the county's prevailing wage law, you are leveling the playing field. It is well established the prevailing wage prevents low road contractors from undercutting quality contractors, companies like mine who are committed to paying families supporting wages and benefits. When a playing field is leveled, I know my company can compete and can win contracts. Second, prevailing wage helps companies like mine retain trained and skilled workforce. In turn, this reduces our turnover. This reduces our injury rates. This boosts our productivity. It lowers our overall costs to support the prevailing wage and to pay the prevailing wage. All of these factors combined help offset the prevailing wage on our construction costs. Thank you for the opportunity to testify. Please vote in favor of this bill. Thank you.
Thank you, Ms. Craig. Our next speaker is Kurt Snyder. Mr. Snyder, you can begin your testimony when you're ready, and you have 2 minutes. I see your video is on. Can you unmute, Mr. Snyder? There you go. There you go.
My name is Kurt Snyder, and I'm the Marketing Communications Manager of the Sheet Metal and Air Conditioning National Contractors Association of the Mid-Atlantic. SMACNA is a worldwide organization that represents more than 3,500 sheet metal and HVAC companies worldwide. We have over nearly 4 dozen firms located here in Maryland, with some of those having offices in Montgomery County. SMACNA supports Bill 3521 because it does lower the county's prevailing wage threshold to $250,000 and expands its coverage to include routine operation, repair, and service contracts for the maintenance of existing structures, buildings, real property that will significantly increase and restore the socioeconomic areas of the county as well. So we desperately need this bill to pass. These modifications are truly dynamic game changers for SMACNA members and some of the other ladies and gentlemen who have spoken before me. They allow us to compete on a broad range of projects. And from the contractor's perspective, prevailing wage is very helpful because it does level the playing field for the ethical contractors versus those who look to take advantage of the system, not only taking advantage of county funds, but even worse, taking advantage of hardworking men and women. Prevailing wage signals to high road companies that they can compete and win government contracts. Experience shows that by raising standards for workers, governments can encourage more companies to bid for contracts. In closing, SMACNA does also support the local hiring portion of Bill 3521. It is good public policy to have local taxpayer dollars create local jobs for Montgomery County residents. On behalf of all the sheet metal contractors who belong to SMACNA, we urge the County Council to pass Bill 3521 as soon as possible. Thank you for the opportunity to speak with you all.
Thank you, Mr. Snyder. George McGill, I see you there on camera. If you can unmute yourself, you have 2 minutes for your testimony, and you may begin, sir.
Okay, thank you very much, council members, for this opportunity to talk to y'all. My name is George McGill. I am a proud gainful member, employee of Local 602. I entered early in my life. I was a young man, made some mistakes and was incarcerated from 84 to 88. I wasn't proud of that, but when I was paroled, I had entered into the Steam Fitters Apprenticeship Training Program in 90, worked hard, and several years later became a German person. Soon then, I had built a great career with excellent health care and benefits, and I feel incredibly blessed. Stories like mine are not unusual in this trade. As someone who has lived it, I can tell you that our training program is open to everyone, women, men, Black, white, Hispanic, straight, gays, ex-felons, and straight A students. If you are ready for hard work and put in the time, our training program will give you a career and a lifetime to be proud of. Please support Bill 35-21 and the service contract amendments so that we can continue giving second chances and building great careers. Thank you very much.
Thank you so much for your testimony, Mr. McGill. Mr. President, that wraps up the speakers for this public hearing. You're muted.
You're on mute.
Sorry. Thank you so much to all our speakers for all your great testimony. We heard some great input from all of you, and I received some feedback that many of you referred to written testimony that is not yet online, and we'll make sure our staff addresses that issue and that all your written testimony is online as well and in front of all the council members. I know my colleagues have a few comments. Councilmember Jawando.
Thank you, Mr. President, and glad to partner with you on this bill. Appreciate, I think the perfect way to end was with Courtney's testimony from the Steamfitters about how this has so many downstream impacts. Appreciate all the great work that all of the union and the trades do to build great projects. And just want to let you know, since it's came up many times, we are working on those amendments. And when we take it to committee, some of them we've already got prepared. So appreciate the input and your testimony today. Thank you, Mr. President.
Thank you. Yeah, we're glad to see so many of our guests here, and I'll continue to lobby many of you to build a training center in East County or anywhere else in Montgomery County. This is a very consistent with our commitment to racial equity and social justice. Who else? Do we have anybody else? Thought I saw a hand raised. Okay, great. Thank you.
Mr. President, I had texted you.
Oh, you did. I'm sorry. Councilmember Chair Novato.
Thank you so much. I also want to thank everybody who came to testify. I wanted to add my name as a co-sponsor. I had to leave early the day that it was actually introduced, and the message didn't get to you, Mr. President, that I wanted to be added. I look forward to our session in my committee, the GO committee, and I really look forward to all the different components contained herein. I think we've heard really great testimony, and you don't need to lobby me about the East County having a training center, something we've been trying to do for a very long time. Well, my colleagues are nodding because they know that we've been ready, as they say. Thank you.
Right. I'm tired of touring all the training centers just in Prince George's County. We have an awful lot of non-college bound high school graduates in Montgomery County as well, who have to travel a long way. Okay. Thank you so much. The hearing on Bill 3521 is closed. Next, we can move on to item 6, which is a public hearing on zoning text amendment 2106, exemptions, density transfer, and historic resources. The ZTA would establish a new residential lots and parcels exemption for density transfer and historic resources. A Fed committee work session on this ZTA will be scheduled for a later date. Persons wishing to submit additional material for our consideration should do so before the close of business on November 9th. Ms. Kennedy, you're on.
Okay, our first speaker for this public hearing is Casey Anderson. Mr. Anderson, you have 2 minutes. You may begin when you're ready.
Thank you. The planning board supports this CTA. It would allow limited commercial uses on residential properties that have a historic resource that is protected by a density transfer if it meets certain findings. Very similar provision was in the old zoning code before 2014, but did not get carried over in the zoning code rewrite. This essentially restores it, although it does add a couple of additional conditions the planning board has to find in order for a property to qualify. We'd also note that this CTA is the first one introduced after the effective date of the requirement that you adopted for racial equity analysis. We are all in agreement that this has very minimal impact, really one way or the other, because it only affects a couple, maybe 1 or 2 properties. But I just wanted to call your attention to the fact that we are applying that. And I think we obviously will have some work to do in trying to figure out exactly how the racial equity analysis applies in the context of zoning text amendments. But we look forward to continuing to refine that in collaboration with OLO. Thanks very much.
Thank you, Mr. Anderson. Our next speaker for this public hearing is Larry Goodwin. Mr. Goodwin, you have 2 minutes for your testimony. You may begin.
Hi, my name's Larry Goodwin. I'm the principal with 1788 Holdings. We bought the Magruder House property back in 2018, and we bought it with the view of restoring a bank at the property. as had been for quite some time. Given the changes that have taken place in the banking industry, the banks weren't interested in having split operations, so they had operations of the bank and the house, and the drive-through separate out on the corner. We've met with the planning board and the historic preservation board about having a parcel put out on the corner that could accommodate a bank, and so they'd have all their operations in one place. And they were in agreement with that.
Mr. Goodwin, could you speak up a little bit? Your microphone is fading. Yeah.
Oh, I'm sorry.
Could speak
Okay.
up a little bit. That would be helpful. Thank you, sir.
Can you hear me now?
Yes.
Okay, I think I had it on low. I'm sorry about that. In any case, the long story short, we buy historic properties and seek to put them in good hands. The goal here is to reactivate the Magruder House, get a tenant that will better fit the house, and all likely a professional tenant, law firm, accounting firm, architecture, etc. In all likelihood, that is viewed as would be a pretty tough road for them to take on the full oversight of the house and keeping it up to standards. We had asked about having the bank ability to reestablished on the corner. Given the environment with the bank, we've had discussions with the planning board about having some additional uses available to be put out in the building that would be built on the corner, and together they would take on the obligation of keeping the house in good order and really making the grounds available for the public. And so our hope is that, if it's about making sure that the Magruder House stays in good condition, it's in the public hands.
Mr. Goodwin, I'm so sorry for the interruption, but your time is up. Thank you so much for your testimony, sir. Our next speaker for this public hearing is Philip Hummel. Mr. Hummel, you have 2 minutes. You may begin when you're ready.
Good afternoon, council members. My name is Philip Hummel. I'm with Miles and Stockbridge. Our law firm represents 1788 Holdings, which is the owner of 7340 Westlake Terrace in Bethesda. This property contains a designated historic resource commonly known as the Magruder House. As was just mentioned by Mr. Goodwin, 1788 has diligently marketed the vacant property for re-tenanting by a bank for over 2 years, first through use of the existing improvements on site, and then by replacing the existing teller structure with a modern bank building. These efforts, unfortunately, have been unsuccessful, and ZTA 2106 is needed to activate the site. As stated in our November 1st letter to the council, 1788 fully supports adoption of the ZTA. The ZTA will reinstate a provision from the 2004 zoning ordinance that was inadvertently omitted from the revised 2014 zoning ordinance for sites containing a historic resource where there has been a density transfer. The ZTA will also support adaptive reuse of 1788's property by allowing re-tenanting with compatible commercial uses. This, in turn, will provide resources for the preservation of the Magruder House, activate the currently vacant site, and enhance awareness of an important historic resource. Lastly, the ZTA will ensure proper oversight by the Planning Board and Historic Preservation Commission when reviewing development proposals on sites like 7340 Westlake Terrace. Consistent with the favorable recommendations of the HPC, planning staff, and the Planning Board, we respectfully request the County Council adopt ZTA 2106. Thank you very much.
Thank you for your testimony. Mr. President, that wraps up the speakers for this public hearing.
Thank you so much to all our speakers. This public hearing is now closed. Item 7 is a public hearing on a special appropriation to the county government's FY22 operating budget, guaranteed income non-departmental account, guaranteed income pilot program in the amount of $1,993,832. Persons wishing to submit additional material for the council's consideration should do so before the close of business today. Ms. Kennedy, could you please call on our speaker?
Yes, our first speaker for this hearing is Gabriel Acevero. Mr. Acevero, you have 2 minutes for your testimony. You may begin.
Good afternoon, and thank you, Council President, members of the Council. For the record, I am Delegate Gabriel Acevero, and I represent District 39, which is the northwestern part of our county. And I'm really glad to be here to, one, applaud the sponsors of this special appropriation for this pilot program, but to also applaud the council in advance for passing it. Let me just share that since being elected, I've been introducing legislation on universal basic income or guaranteed income in Annapolis for a number of reasons. If we look at the studies, the average American cannot afford a $500 or more unexpected bill. And that's just the reality of the America that we live in. And so universal basic income or guaranteed income in this case is one of the most effective anti-poverty programs that we can implement as government officials to ensure that we're having or putting a serious dent in poverty. And so this program, this pilot program will allow us to not only help those across our county who are in need, particularly low-income households, it will really, in my opinion, prove the effectiveness of direct cash assistance, which is what we're fighting for at the end of the day. When we talk to low-income communities, when we talk to LGBTQ plus folks, one of the things that we keep hearing is the importance of direct cash assistance. The annual income of transgender Americans are between $15,000 to $17,000 annually below the federal poverty line. And I know Councilmember Glass knows this very well, that when we talk to members of our community, what we hear often is the impact, the positive impact that direct cash assistance has on low-income folks, not just as a handout, but a hand up. And so while UBI or guaranteed income is designed specifically for the federal and the state level, as I like to argue, localities are the laboratories of guaranteed income, because what it shows is not just the need, but the positive impact that we can have when we give people cash to meet their basic needs. So I want to applaud the council and to continue doing this and for leading, quite frankly, the rest of the state on this very important issue. And my hope is that it would have a snowball effect in terms of legislation that I will continue to introduce to give all Marylanders $500 a month, no questions asked, to meet their basic needs, and for us to fund it by looking at our very archaic and regressive tax code.
Thank you, Mr. Acevero. So sorry for the interruption, but your time is up. Thank you for your testimony. Our next speaker for this public hearing is Robert Eisenberg. Mr. Eisenberg, you have 2 minutes and you may begin.
Thank you for the opportunity to speak to the council today. My name is Robert Eisenberg, and I've been a resident of Montgomery County since 1985. Both of my children's K-12 education was in Montgomery County Public Schools. I am strongly opposed to this pilot program to provide guaranteed income to county residents. So why? Because I believe that we serve those in need best when we help them improve their condition for the long term, not merely by providing immediate relief. I believe this type of program may actually discourage self-improvement and advancement. So what would I advocate instead? How about providing financial supplements to those who are working but still struggle financially, the so-called working poor? How about subsidies for childcare to enable people to enter the workforce? How about stipends and educational supplements to those attending an educational or vocational program? Yes, we can and should help improve the lives of those in need within our county. However, we can, and I believe should, do it in ways that will lead to greater self-sufficiency over programs that may lead to greater dependency. In addition to the potential negative effect at the individual level, this program could also be bad for the local economy. Some neighbors of mine own a small business within the county. They have been struggling to hire new employees. Providing income without a connection to employment or education could only exacerbate the employment challenges of our local small businesses. So I urge you to consider other options to help those in need, as opposed to a guaranteed income approach. Or perhaps even run parallel pilots using the available funds to actually compare the outcomes of different approaches when applied within our county. Thank you.
Thank you for your testimony. Our next speaker for this public hearing is Courtney Hall. Courtney, you have 2 minutes for your testimony. You may begin when you're ready.
Good afternoon, council members. My name is Courtney Hall. I serve as the CEO for Interfaith Works. At Interfaith Works, we provide pathways to stability for our neighbors in Montgomery County. And I am pleased to testify today in support of the special appropriation for the Guaranteed Income Pilot Program. In my opinion, this Our program has the potential to be an excellent pilot program. In general, Interfaith Works supports the concept as we know that many in our community are facing the scary reality of poverty and could benefit from additional financial assistance. Especially alluring to us is the idea of including up to 100 people who are being served by the homeless services system. Guaranteed income could help some residents end an episode of homelessness, therefore allowing them to afford rent and other costs that are related to housing. However, there are several questions that I believe should be addressed before enacting the legislation. For example, will an income threshold be applied to participants, or will this mirror the other universal basic income models, as Delegate Acevedo mentioned? The proposed legislation indicates that up to 100 of the selected households will be served by the homeless services system. Will there be additional criteria to further define eligibility for this guaranteed income? Another question. Will there be a mechanism to ensure that participants can also be referred to social service supports if necessary? What steps will be taken to ensure that the guaranteed income will not affect other financial assistance that may be received by participants? If this is treated as reportable income, then there are some residents who might inadvertently exceed the income threshold for vital public support, like SNAP, Medicaid, TANF, etc. So in conclusion, we support this. My team and I would be very pleased to serve as a thought partner to the County Council as you continue the process of forming this legislation. Thank you.
Thank you for your testimony, sir. Our next speaker is Rick Cottle. Mr. Cottle, you may begin your testimony when you're ready, and you have 2 minutes.
Sorry, I'm a little nervous, my first time at this, but I know all of this is public knowledge and that people have access to learn of this program, but most hardworking taxpayers are too busy working and raising their families to have the time or the energy to follow every piece of government overreach that passes through this council. I recently decided to take an active role in following what my local government was doing, and in doing so, I can't tell you how concerned and discouraged I am. I'm here to tell you today, enough is enough. This program stands against everything I believe in as a citizen, a taxpayer, and a human being. I am not the product of wealth or prosperity. I am the product of hardworking, lower middle-class parents who worked in retail in small-town Appalachia. I had to leave my hometown to find meaningful work, which is what landed me in this county. I understand what it takes to rise from poverty. I have grown up around friends and family whose parents gave them a lot more than I was ever given or was provided for my parents, and I have seen myself go a lot further on a lot less than they ever did. These experiences, along with studying history and reading many philosophers, have taught me to understand the ideology of socialism. I have limited time here today to delve into the many issues I have with this ideology and this program, but I will state the two most obvious issues. One, you don't help people by giving them stuff. And two, you don't help people by stealing from them. In essence, you are conducting an experiment that has already proven to fail. It fails with individuals who grow up having everything given to them. It fails to the generational families that grow up in the public welfare system. And it fails in societies that fully embrace the socialist model. The history is there if you wish to open your minds and remove your biases. I have no problem with philanthropists who wish to engage in this experiment, personally funding and managing such a program. I have no problem with programs that help the disabled and mentally ill. However, it is unfair and unethical to ask the hardworking taxpayers to have a stake in this ideological experiment, especially those who know where it leads. I ask that you do not take 1 penny of taxpayer dollars to fund this program. Thank you.
Thank you for your testimony. Our next speaker is Sunjata Suma. Sunjata, you have 2 minutes for your testimony, and you may begin when you're ready.
Hello, thank you. Can you hear me?
You can.
All right, thank you so much. Hello, Montgomery County Council and residents, and thank you for holding this crucial hearing. My name is Sunjata Suma. I live in the Silver Spring Fairland area, and my testimony is in support of the Guaranteed Income Program. I've lived in Montgomery County most of my life, but it has not been easy staying here. Despite working multiple jobs as a nurse in Baltimore and Virginia, my single mother made sure I grew up here because she saw the value, security, and opportunity in this place. The times I lived in other counties, I compared firsthand to know that I could live a better, safer life here with a better education. I felt underserved there and that I wasn't reaching my full potential, so my mother made sure I went to high school here despite it being incredibly inconvenient for her. She would work 16-hour shifts, often back-to-back at multiple jobs to make sure we could afford to live here. I would go days without seeing my mother because she was so busy at work. Financial insecurity formed a huge rift between us, and I was scared to ask for things I knew I needed because I knew money was tight. My mother was always stressed out, and it was evident in our interactions. With a guaranteed income, my mother could have been more present in my life, but that's the sacrifice she made for me to graduate from Montgomery County. I graduated with a full tuition merit scholarship to Rensselaer Polytechnic Institute, but due to COVID, I had to leave school and I lost the job I used to pay for my cost of living. Since then, financial issues have prevented me from finishing my degree and I've exhausted my scholarship. My mother is now looking to retire, so I'm fully independent at this point. $800 a month would give me the income I need to pay my overdue rent so I can start investing in myself. When I return to school, $800 a month will give me the freedom I need to devote my attention to finishing my degree. I have a son, and much like my relationship with my mother, I find that financial security is taking me out of being as present in his life as I want to. Right now, I'm struggling, but a universal basic income program could turn my struggle into realization of my goals. I want you to see me as an opportunity of the potential here, as an example of the potential here in Montgomery County. There are so many people here who share similar stories that if they had the financial security they needed, they'd thrive. Thank you for allowing me to speak, and I hope you support a guaranteed income for our residents.
Thank you, Mr. Suma. Our next speaker is Sonia Climaco, and she will have translation from Valerie Salazar from Impact Silver Spring.
Buenas tardes a todos los presentes. Mi nombre es Sonia Climaco, vivo en el condado de Montgomery hace 16 años.
Good afternoon to everyone present. My name is Sonia Climaco, and I have lived in Montgomery County for 16 years.
Soy ama de casa, madre de 2 niñas y emprendedora.
I am a housewife, mother of 2 girls, and an entrepreneur.
Resido en el 3506 Peachtree, Silver Spring, Maryland, 2096.
I reside at 3506 Peachtree Court, Silver Spring, Maryland, 20906.
Debido al alto costo del cuidado infantil y nuestros ingresos limitados, me he quedado en casa para cuidar a mis hijos y mi familia.
Due to the high cost of childcare and our limited income, I have stayed home to take care of my children.
Mi esposo trabaja en la industria de la construcción, pero como muchas personas, su trabajo se redujo durante la pandemia. Todavía no ha podido obtener la misma cantidad de horas de trabajo que recibía antes del COVID.
My husband works in the construction industry, but like many people, his work hours were reduced. He still has not been able to get the same amount of work since getting before the pandemic.
I don't give a shit.
Con el fin de contribuir a la situación económica de mi familia, he estado trabajando para establecer mi propio negocio desde casa, mientras cuido a mis hijas, haciendo y vendiendo artesanías y joyas.
In order to help contribute towards my family's economic situation, I've been working on establishing my own business from home while I take care of my children, making and selling arts and craft and jewelry.
Además, participo activamente en el desarrollo social de mi vecindario y ciudad.
In addition, I am an active social development in the neighborhood and my city.
He participado en clases cívicas que ofrece el condado y en diferentes programas de desarrollo educativo con Impact Silver Spring, incluida la Academia de Costura.
I have participated in civic classes offered by the county and different educational development programs with Impact Silver Spring, including the Sewing Academy.
Recibir un pago mensual a través de una iniciativa como la del ingreso básico garantizado ayudará a contribuir a la estabilidad económica de mi familia y me ayudará a seguir desarrollándome mi pequeña empresa.
Receiving a monthly payment through an initiative like the Guaranteed Basic Income will help contribute to the economic stability of my family and help me continue developing my small business.
Por ejemplo, pude recibir una asistencia en efectivo de COVID de $500 de parte de Impact Silver Spring el año pasado. Usé este dinero para comprar mi propia máquina de coser y otros suministros y materiales que me permitieron producir y vender algunas de mis obras de arte.
For example, I was able to receive a $500 COVID cash assistance from Impact Silver Spring this past year. I used this money to purchase my own sewing machine and other supplies and materials that enabled me to produce and sell some of my art.
Recibir este pago único en efectivo nos ofreció a mí y mi familia un tremendo impulso.
Receiving this one-time cash payment offered me and my family a tremendous boost.
Si las familias de bajos ingresos como la mía pudieran recibir este tipo de apoyo de manera regular y mensual,
if low-income families like mine were able to receive this kind of support on a regular monthly basis,
se obtendrían muchos beneficios sociales y económicos positivos y en general mejores condiciones de vida para nosotros.
it would lead to many positive social and economic benefits and overall life conditions for us.
Ms. Salazar, Ms. Climaco, that's all we have time for. Thank you so much for your testimony. We appreciate it.
Thank you.
Thank you. Our next speaker is Corrine Carlton. Ms. Carlton, you have 2 minutes for your testimony. You may begin.
Thank you, guys. Oh, here we go. Good afternoon. My name is Corrine Carlton, and I am from Germantown, Maryland. Thank you in advance for this Guaranteed Income Pilot Program. I'm a mom of 2 4-year-olds, currently working 2 jobs, and I do my best to support my family with just a few hours on the weekend to spend with them. I believe I'm tearing up at this right now. At the end of 2019, I was prepping to open a business and had just 1 week to go before COVID decided that it's going to hit. So I had to shut everything down, leased equipment, registered business, doing my build out, and then just had to close. I still had my job. I still had my family to support and raise. And I had to just make sure that I paid attention to what my next step was going to be, see what my options were. Now, as a new business, no revenue, I did not qualify for the PPE. So I had to really just suck it up and see how long I could hold on. And honestly, I couldn't hold on because there were expenses that were incurring. After a few months, I reached out to the company that I leased equipment from to see if they could do a reduced payment or return it. And obviously, when you really get into it, the reduced payment wasn't really working. They were just going to defer it to the end. And so obviously I returned the equipment and they said, okay, we'll auction it off and you pay the difference. And I was relying on their expertise. So I allowed them to auction it off because obviously in the beginning of all of this, I thought that, well, my business opened 12 to 18 months, I'll pay off this debt. Well, when they decided to auction it off, they auctioned off $17,000 worth of equipment for just under $2,500. Awesome. And they were looking for me to pay the balance of that. Well, that couldn't happen. I was making a couple of dollars, both jobs, just above minimum wage. So it wasn't really economical for me to stay the course. And the equipment was unused, and this is what they did with it. Nevertheless, when they did all that, I still had to support my family and still look to pay the original amount. But then I had to think about it, and I actually reached out to Maryland Legal Aid, and they're really fighting feverishly right now. So this is actually an ongoing thing. They're fighting feverishly with this company. I don't know if we should call them a company, but to see how they can resolve it. So the effects of all of this.
Ms. Carlton, I'm so sorry. We understand what you're trying to say here, but your time is up. I am so sorry, but thank you so much for coming and giving us your testimony. Mr. President, that wraps the speakers for this public hearing.
Thank you, Ms. Carlton. You and all our other speakers did us a wealth of good listening to you this afternoon. Thank you for your powerful testimony. This public hearing is now closed. Item 7.5 is a public hearing on a resolution to adopt an amended Board of Health regulation to prevent the spread of COVID-19 and indoor mask guidance in Montgomery County. Action is scheduled immediately following this hearing. Ms. Kennedy, could you please call on the first speaker?
Yes, our first speaker for this hearing is Matthew Libber. Mr. Libber, you have 2 minutes. You may begin.
President Hucker, members of the council, good seeing you guys again. It's been a couple months. obviously from the Soccerplex. I just want to say I support the amended regulation to put in the 7-day buffer to before we flip back to adding masks again. I get where the mask mandate comes from. I fully support it. I've said that before. Just from a business standpoint, we can't do the back and forth all the time. It causes a lot of issues from an enforcement standpoint and a compliance standpoint. I also do support the proposed amendment for the sunset clause. Obviously, I think you guys need to work on the timing and what makes sense for you guys. But as hopefully today, if we get an approval from the FDA for vaccines for the younger age groups, that'll help move us in the right direction. I know this was talked about this morning, but do want to point out that the other metrics that we also look at, especially from the hospital side of things, all of those have actually been in the low or moderate range since April, and that included about 4 months of not wearing masks. So I think there is some reason to believe that we can move forward without masks later on once the vaccines are fully available to everybody, and just hope we move in that direction. Thank you for your time.
Thank you, Mr. Liber. Our next speaker is Robert Van Alstyne. Mr. Van Alstyne, you have 2 minutes for your testimony, and you may begin. Mr. Van Alstyne, are you there?
Can you hear me?
We can.
Okay. Sorry about that.
That's okay.
My name is Robert Van Alstyne. I really do appreciate the council giving me the time to speak today. If the county continues what it's done throughout the pandemic and follows the science, it should permanently lift the indoor mask mandate and create a high bar for its reinstatement. As shown by our vaccination rate, 99% of the citizens know what it takes to protect themselves and their families, and should be given the freedom to decide what, if any, additional protective measures to take. Reinstating a blanket indoor mask mandate based solely on case counts would be ignoring the science and put the citizens of the county at additional risk. Indoor masking is an emergency last-ditch measure to protect an overwhelmed hospital system, which is thankfully not the case in Montgomery County. In fact, our hospitalization and beds occupied due to COVID are low. The reason for this goes back to our 99% vaccination rate and is not due to the indoor mask mandate. This is proven by the fact that Howard County, with no mask mandate, has a lower case rate than Montgomery County. In fact, the increase in cases that pushed the county to just above a 50 case per day metric occurred while the mandate was in effect and have since come down. The science is clear. The driver of our low positivity in case rates are the vaccinated population, not cloth masks. Using only case rates to drive policy is lazy, reckless, and harming our children. As Council Member Ringer pointed out, case counts can be triggered by a data dump or old data. Using old data to make decisions is, quite frankly, lazy policy. A large part of the county population is sick of the masks, and if the policy to continue masking is based on just case counts, will actively avoid being tested even if they present symptoms. If the point of masking is to prevent spread, punishing those who don't want mask mandates and won't be tested as a result will unintentionally increase community spread. As Vice President Albornoz mentioned yesterday, the county is seeing unprecedented rise in the number of teens hospitalized long-term for mental health reasons. Continued masking will only exacerbate this crisis that is harming our kids and causing math test scores to drop 25% across the county.
Mr. Van Alstyne, I'm so sorry, your time is up, but thank you so much for your testimony. Our next speaker for this public hearing is Paul Meyer. Mr. Meyer, you have 2 minutes for your testimony. You may begin when you're ready.
Thank you. I'm testifying today in my role as a parent of a 2-year-old. It goes without saying that his health and safety are the most important things to me. However, I'm testifying against the reinstatement of the mask mandate for all residents based on the CDC's flawed metric of substantial transmission. Why? Because the conditions don't justify it. The best thing that we can do to protect young children is for the people around them to be vaccinated. And in a county with a 99% vaccination rate, we've taken care of that. But now, case rates are not the correct metric. Case rates made sense before vaccines were widely available. However, with virtually the entire county vaccinated, and with 5 to 11-year-olds next, we should not be reinstating the mask mandate. My son has been in daycare since December 2020. The entire time, his teachers have been wearing masks. Again, before the wide availability of vaccines and when the Delta variant was spreading, this made sense. However, we can't pretend that there aren't any harms to children from long-term mask wearing when the conditions don't warrant it. These are children who are still learning how to speak, and they're not able to see their teachers' or classmates' mouths. Finally, if we're going to keep going back and forth with mask mandates, which it sounds like we are, we need to discuss what our goals are here. COVID is endemic in Montgomery County. So are we trying to get to zero COVID? Almost all experts agree that this is impossible. So if that's not the goal, then we need to have a real discussion about what levels of risk we're willing to accept. This is something that elected officials need to decide. We can't keep delegating decisions to the health department. For all of these reasons, I'm testifying against the reinstatement of the across-the-board indoor mask mandate. Thank you.
Thank you for your testimony. Our next speaker is Bradley Jensen. Mr. Jensen, you have 2 minutes for your testimony, and you may begin when you're ready.
All right, I think I got it set up now. Thank you very much for the opportunity to speak. And just quickly to Rob and Paul, I concur wholeheartedly in their statements. You know, as a parent and as a resident, I do appreciate the council's efforts here to try and figure this out. Though, no, it's not an easy answer, and the work that's been done. But again, to Rob and Paul, thank you for your comments, and I concur wholeheartedly. So I had 2 comments really. After listening to this morning's discussions on this. So the first is I do appreciate the move to provide predictability. I hate nothing more than flip-flopping. So I appreciate that coming from the council. But I was impressed that the comments really didn't focus on masks this morning. It focused on vaccinations. And so if vaccination, specifically on our 5 to 11-year-olds, and so thus if vaccination is the precursor to success and it's the focus of the committee, then that's what we should be discussing. We should not be discussing mask mandates. They should go away. And that should be where we move and how we focus our time and our efforts and the money that I'm paying as a taxpayer for the council members to focus on these issues. Further, by way of reference, the insistence on mask mandates has required my family and others to remove our children from Montgomery County schools and to take the bulk of our business to counties where mask mandates aren't required so that we can enjoy the freedoms that come with unmasking. So again, if the focus is on vaccinations, then please readjust your priorities and your efforts as a council accordingly. Second, if this is going to continue, which again, as Paul said, is probably going to be the case, right? Regarding a sunset provision, I'm in favor of it. I strongly encourage each council member to also support a sunset provision. A sunset provision forces you, council members, as our elected officials, to re-engage on the issue. It puts a time limit on an intrusive measure and prevents an abuse of your delegated power by making you re-justify the need for such a mandate. Thank you very much for your time.
Thank you, Mr. Jensen. Our next speaker is Fadi Jarabian. Mr. Jarabian, you have 2 minutes for your speech, and you can begin when you're ready, your testimony.
Okay, thank you so much. I labored over writing what I was going to say, but I am very happy with hearing all the previous speakers. They totally did a lot of good. I'm in full agreement with them, and I'm very happy to hear our residents are of like mind. So obviously, I agree with the amendment to minimize this flip-flopping, and it does look like this masking policy is based on this one criteria of substantial transmission, which is set by CDC definition, which in my opinion is outdated because at some point substantial transmission meant death, but now with vaccinations and natural immunity and everything all over in all the good numbers, when transmission does not equal high mortality and high hospitalization and severe COVID, it just means in the vast majority of the cases, it means mild symptoms or asymptomatic. So giving all this weight to this transmission rate is incorrect. Also, the county has all these other primary and secondary criteria, mortality is not part of it, which should be, which is less than 10. Hospitalization is part of it, which is only 5.5%, and vaccination rate, everybody knows, is extremely high. But the confusing part also is that this transmission, substantial transmission, is substantial, but at the same time, on the same page, we see this other criteria that says low positivity rate of 1.5%. So which is it? Is it low or is it high? These two seem to contradict each other too. So, and that kind of, I think, brings to point, it clarifies that this transmission rating of substantial is incorrect. The other thing that I like to point out is that having an ill-defined masking policy, it contributes to the misperception that vaccines are ineffective and there's no end in sight. And having this no end in sight, it exacerbates this overall mental health issues, drug dependencies, and other psychological issues. Additionally, a lot of people I know.
I'm so sorry for the interruption, Ms. Jaraban. Your time is up, but thank you so much for your testimony today. We appreciate it. Okay. Our next speaker for this public hearing is Marjorie Smelkinson. Ms. Smelkinson, you have 2 minutes for your testimony, and you may begin when you're ready. Are you there, Marjorie? I see her there. Can you give us a test of your microphone?
Can you hear me?
We can. There you go.
Okay.
Gotcha. Okay, you can begin when you're ready.
Okay. My name is Dr. Marjorie Smelkinson, and I'm an.
Now we can't hear you. Are your headphones plugged in? We still can't hear you. Maybe you should unplug your headphones.
Can you hear me?
Yes, we can hear you now. There you go.
Hope it stays. Sorry. Okay. My name is Dr. Marjorie Smelkinson, and I'm an infectious disease scientist in Montgomery County. SARS-CoV-2 has become endemic, meaning that all Americans, regardless of their vaccination status, will be infected at some point in their lifetime. Fortunately, Montgomery County is the most vaccinated county in the whole country, ensuring that most of these infections will be mild or asymptomatic. This means that a rise in local cases no longer represents the serious public health threat that it used to. Unfortunately, MoCo continues to focus solely on cases when deciding upon mitigation measures such as mask mandates. Given the county's significant asymptomatic surveillance testing, it may be years before we consistently meet the CDC standard for unmasking. Given our amazing vaccination rate, counting infections is simply the wrong metric to determine restrictions. Doctors Monica Gandhi, Ashish Jha, and Saira Madad, all very prominent public health officials, have written that vaccinated areas should focus on hospitalization rates instead of cases. To remove restrictions, they recommended a very conservative rate of 5 to 10 hospitalizations per 100,000. We are well below this at 2 hospitalizations per 100,000, and it continues to drop. And for comparison, we don't implement restrictions during a typical flu season, which often has 5 times as many hospitalizations as we have now for COVID. Perspective has been warped, and we need to regain it. This is not throwing caution to the wind. Rather, I urge you, at a minimum, to adopt a better metric for making decisions about COVID mitigation. A low hospitalization rate means that the disease is well managed and presents low risk to county residents. Many of us are frustrated and want normalcy for ourselves and our children, many of whom don't even remember lives before masks and canceled activities. Montgomery County is safe, and we need real leadership to revive this county. Thank you.
Thank you for your testimony. Mr. President, that wraps up the speakers for this public hearing.
Thank you so much to all our speakers. We really appreciate your input, and so many of you who have communicated with us over the last few days. This public hearing is now closed. So item 7.6 is action on the resolution to adopt an amended Board of Health regulation to prevent the spread of COVID-19 and indoor mask guidance in Montgomery County. Is there a motion to approve the resolution?
So moved.
Council Vice
Second.
President moves. Council Member Novato seconds. Can we have discussion? Councilmember Rice.
Thank you very much, Mr. President. I wanted to comment on a couple things that were said as a part of the public hearing. And as you said, I wanted to make sure that folks just had an opportunity to speak. But as the chair of the Education and Culture Committee, I think it's really important for us to make sure that folks understand, while they do certainly cite cases of where we have high vaccination rates, amongst our children is where they are the lowest. And the reason why is because we've yet to get those rolled out, including those to where they're still not eligible. And hopefully today we'll hear from the CDC that we can go ahead and moving forward with those vaccinations. So I think that while their conversation is correct, it's just a bit early. And so I ask for patience. My kids are older now. My daughter's a sophomore in high school, but certainly one in which I talk to parents all the time. And that's what I want to remind folks as well, that although we heard from a lot of folks that were here on this Zoom call today, we talk to parents and individuals in our community each and every day. And they talk about the issues and the concerns that they have, and just as many are concerned about not having masks as having masks. And so I want to just make sure that that's very clear. And so for those who cite preponderance of folks in one space or another, trust me, we know because we hear from all of our constituents all the time about what percentages are where, and also are guided by a lot of the information that we get from our public health officials that are primarily the ones that are guiding us in making these decisions. I will say that, look, regardless of whether folks believe in the CDC, we have from the very beginning said that we were making sure that we made decisions based on CDC guidance. That's how we led this effort, and that's why we're at the high percentage of vaccinations and the low percentage of hospitalizations. So let me just remind folks that for those who criticize this council, we were the ones who said that we would follow the guidance of CDC and our public health officials, and are the reason why we are in this place, along with cooperation from our public who followed that same guidance. So thank you to everyone who followed along, but there's also thanks to the folks who made those decisions to make sure that these things were in place to keep us all safe. And so I just need to reiterate that, because I think that oftentimes folks forget about how this started. This council was committed from the very beginning to lead with safety, to lead with making sure that our most vulnerable in our community were protected. And we did just that, and we achieved that. And so everyone across the board is to be lauded. And so to then question where folks are in terms of intentions at this point seems kind of misdirected, because it was all of us at the beginning that were in this together, and we're still in it together. So from that perspective, let's lead like we have been, be the example for the country that we have been. Let's make sure that we get our youngest and most vulnerable vaccinated, and then we can talk about continuing to lift all together this mandate. I agree with what folks have said, that we are getting to that point. It's just we're not there yet. We're almost there. And so there's no reason now to throw caution into the wind. We need to make sure that we remain committed and vigilant like we have been, protecting our most youngest and vulnerable. And then once we get there in terms of a percentage of those vaccinated, we can move forward. So, Mr. President, just want to make sure that, from an education and culture perspective in terms of our children that are in school. And one of the last things that I wanted to say, there was something that was said about folks and about our children and the masks actually contributing to the negative performance in school. I read literature on a daily basis. We certainly understand that them being away from school has contributed to some of the negative education performances. But I've seen no studies that have said that wearing a mask actually dictates you performing less when it comes to the school acumen. So from that perspective, I'm not sure where that's coming from, but just want to assure my colleagues that I'm trying to stay up on a lot of the latest information that's out there, and I haven't seen anything that says that wearing a mask actually somehow impacts your educational ability in the classroom. So thank you, Mr. President.
Colleagues, any other comments on the Councilmember Friedson?
Thank you, Mr. President. Appreciate everybody's efforts here as discussed earlier today. I think adding a level of predictability here is very helpful. Just wanted to thank Dr. Bridgers, Dr. Stoddard, and the health team again for all of their collaboration. Certainly not easy to make health decisions as a 9-member board of health. This is a challenging environment for all of us, but I know everybody is working really hard to try to come to a good outcome, to keep everybody safe, to follow the guidelines as presented to us by the public health officials. Earlier today, I had mentioned and discussed the proposal that I was going to put forward related to a date certain, December 31st termination of the order. Based on the feedback from colleagues this morning, it seems that there is less of a comfort level with a date certain option as there is with the other option that we had discussed internally, which ties to vaccination rates. And so if it pleases you, Mr. President, I would put that forward now. And I think Ms. Wellens is on the line, or we can wait to go through the order, depending on what your preference is.
I think that's entirely within order. In order. I don't have any other requests to speak. So yeah, why don't you move the amendment?
Terrific, thank you. So I'll just quickly summarize, and then I'll ask Ms. Wellens, and appreciate her work around the clock the last few days in drafting many different options. But if she could put up to share with colleagues and with the public. But basically, this is a termination that would take effect when 85% or more of the county's total population is fully vaccinated, as reported by the CDC on its COVID data tracker, without requiring any further action. It specifically explains what that data point is, because there had been some confusion of how we were calculating things and what we were calculating. And so this would clarify it as part of the amendment. And it just notes that as of this morning, the CDC's total vaccination number is 77.5%. So 85%, which is a number that is being used by the health department for a number of other metrics, that would be 7.5%. Just as a frame of reference, our 5 to 11 population at 105,000 people is approximately 10% of the total 1.05 population. And so, just to give a frame of reference to everybody for what the numbers mean, how many new residents are going to be eligible, we want to get that eligibility up to. So that would get us to 85%, a substantial number of the total population. It follows the similar approach that we took last spring to try to encourage folks to get vaccinated and tie the termination of the public health restrictions and requirements to that level. And this was discussed in consultation with the public health team over the last several days. So with that, you see it here. And just the last piece, to avoid the confusion of what the data is and what it means and when it takes effect, we clarified all of that, which was also a request and discussion with the health team, so that there wasn't any ambiguity and room for interpretation to make sure that the public and the Board of Health and the health team are all on the same page. So with that, I'd like to move this forward as an amendment.
Is there a second?
Second.
Council Vice President seconds. Any discussion on this amendment? Councilmember Reamer.
Thank you. Well, I think this is probably when we would make comments generally. Actually, you could leave that up. That would probably be good to keep it up on the screen. Thank you so much. I wanted to just make a few very general comments. First of all, I think it's important for the public to know that we're not addressing the mask policy in the schools. The Board of Education makes that policy. And I think there's some confusion that we would be enacting or removing a policy for the schools, and we're not. The Board of Education may look to our council's action for some kind of guidance or input or, expression of a view on general masking in the public, but it's different. And I don't yet have a strong view here about masking in the school setting. I do think that there are significant issues with children with disabilities and the impact on masking for them. And I think the school system really needs to look at that if they're going to keep this mask policy in place further. I don't know what the nuances are of that. I'm sure that they have considered these issues, but I think that's a serious concern. And as far as the academic environment is concerned, I actually do think there is an issue with language learning. And my son is in Spanish. I can't imagine trying to learn a language without being able to see my teacher's face. So that specific issue, for the most part, otherwise, I don't know that there are a ton of issues. I mean, kids don't seem to mind masks for the most part, and I recognize that there are some who do. So I just wanted to make that point generally about what we're doing here today and implications for the school setting. In general, we have fallen out of substantial transmission in the county, and I think it's appropriate to lift the mask requirement generally because of that. And I would be fine with just lifting the mask requirement because we're out of substantial transmission. I don't believe we need a trigger policy. I think we can come back and we can act whenever we'd like to act. And so I would be okay with that. But if there is a strong sense of keeping a trigger in place, I just want to make sure it's clear externally that the regulation to phase out what gets phased out with the vaccination levels is the triggering policy. I mean, it doesn't mean that the county council wouldn't be able to consider a mask requirement, or that we wouldn't act in some other way. And it's possible that this will never be reimposed because it's possible that we'll never go back into substantial transmission. We just don't know. But our action today would allow for the removal of the requirement to wear a mask, and then would set a triggering policy based on vaccination rates, and then would terminate that triggering policy, based on the vaccination rates. And so whether those latter steps are ever needed is unclear. Generally that timeline seems okay. I mean, at some point after the youngest are able to get vaccinated, it's time to remove the requirement and get back to that level of normalcy. And, it could even be a little sooner than the end of the calendar year. It seems like, according to Councilmember Friedson's math work, that, it'll be close to the end of the year when we would be hitting that kind of threshold if the pace is the same for 5 to 11 as it was. Forgive me if I didn't quote you correctly there, Councilmember Friedson. I think I did. So generally, we're heading towards, there will be no trigger policy through the end of the calendar year, after the end of the calendar year, and there will be a triggering policy. Well, and anyway, and if transmission returns, it could be reimposed, if I'm understanding correctly. So thanks.
Thank you. Councilmember Rice.
Yeah, I just had a very quick question and maybe Ms. Wellens can answer this. When we say total population, that does include the cohort that we're talking about. So it's total population is those that are eligible for the vaccination. I don't see the definition. We're not scrolled up on that part. So I just wanted to make sure that that was the case.
The way that it's drafted, it's the total population, including everybody, which would include those who are not eligible. The current number is 77.5% of all residents, and the additional 5 to 11-year-olds would, creates another 10% of the population, approximately, who aren't currently eligible, who would be eligible. So I put that forward. That's the 7.5%. This was in working with the health department. 85% is a threshold that has been used, but the total population and the reference is to the data tracker on the CDC website, which automatically updates every day. This avoids some of the concerns about our calculation versus the CDC's calculation versus the state calculation, and this ties it directly to that to try to avoid the ambiguity and the need for interpretation.
No, let me just say thank you, Councilmember Friedson, and I really appreciate considering moving towards this direction and utilizing, instead of a date certain, an actual number around vaccinations that I mentioned this morning. I think that's smart for us as we look to make sure we can move forward, but move forward safely and effectively. I will just say, to address some of the concerns that Councilmember Reamer has brought about regarding our children and with speech language. I know, especially when it comes to some of our children who have hearing and speech impediment, there's been talk about the utilization of different kinds of PPE that actually has a clear face. Many of you know that my mother, special education teacher that taught at Gallaudet University and Model Secondary School for the Deaf for over 35 years. So special education is one of the core principles of how I was raised and what's incredibly important, and we still talk about those issues. And so the utilization of that, and recommending that when it comes to our children, especially still as we have a mask mandate in place, and it comes to language acquisition, utilizing those PPE that actually have the clear face shield in front and having those distributed in the classroom is something that we've been looking at, working with our school systems, not only here in Montgomery County, but across the state to implement. And so I know that Dr. Stoddard and I talked about that at the very beginning, months ago, when it came to what we were trying to do to ensure that we would minimize those kinds of impacts. And so I agree with you, Councilmember Reamer, that is one of those instances where certainly we have the items that are in place to be able to do that. You'll see that most interpreters now that are doing sign language interpretation use those types of masks, and we see them in a lot of special education settings. So I'll follow up with Dr. McKnight and making sure and checking on the implementation of that, and that we are trying to use that in many of our language settings. I know my daughter is in ASL class at her high school, and they have some of that PPE available. So I'll just make sure that folks across the system are utilizing that to the greatest ability they can. So thank you for raising that, and I'll make sure that I follow up with the school system.
Thank you, Councilmember Friedson.
No, thank you. If we're ready to vote on the amendment, I think it's been moved.
Great. Council Vice President Albornoz, are you on the amendment?
Yeah, on the amendment. Just very quickly, first, I want to thank Councilmember Friedson for his work on this, and thank Ms. Mullins for the language, and once again, thank Dr. Bridgers, who was a great, was very helpful in the development of this bill. As I said this morning, I am open to a sunset for all the reasons we talked about this morning, and I think this approach is much more measured. And as we've known for quite some time now, all roads to getting on the other side of this lead through vaccinations. And this is another opportunity for us to incentivize, as we have in the past, through other policies, encouraging all of our residents. And I have a high degree of confidence here in Montgomery County, our families are going to continue the trend that we have with our youth, in that 5 and 11-year-olds will be signing up to get the vaccination, which is going to put us in a much better spot. So once we hit that threshold, I think it will be not just great news in our fight against this virus, but it will also mean that it will trigger yet another important milestone as we try to get on the other side of this. So I'm supportive of this amendment. I seconded it, and I think it's in line with other decisions we have been making, which is evidence-based and makes a lot of walking around sense. So look forward to voting on this and moving on.
Thank you. Councilmember Novato, are you on the amendment?
Thank you, Mr. President. Yes, Councilmember Fitz and I appreciate this shift. I think it is true. This aligns much better with the current times. I mean, obviously, things have changed in terms of the availability of our vaccines and how our residents have embraced this. And it makes sense for us to be able to tie this to vaccination rates instead of case rates and positivity rates, et cetera. So just want to express my appreciation. And as it was also noted, of course, we can come back at any time to revisit, if there are any circumstances that arise. But to have this as a guiding metric, I think it's important to give clarity, hopefully, to our residents, and also for us to track how we are progressing. So appreciate it, and I'll be supporting it. Thanks.
Councilmember Cass.
Thank you very much, Mr. President. I too want to thank Councilmember Friedson for being flexible and hearing what we said earlier today. I too am supporting this amendment. I think it makes a lot of sense. It tells people where the goal line is, and that's exactly what we need to be doing. And I think this will get us there, and I hope that it gets us there as quickly as possible. Thank you very much, Mr. President.
Thank you. And Councilmember Jawando.
Thank you. Just to be clear for myself and for the millions watching at home, and I'll use another analogy that Councilmember Navarro are saying, trying to follow the bouncing ball here. I know she's off camera, but it's just something she says a lot. And so just to be clear, Ms. Wellens or whoever wants to state this. Okay, so we would have, this would kick in 85% of the population, eligible population is vaccinated. Obviously, we're moving now under FDA action to including, the 5 to 11-year-old population, the 105,000. I've got about a quarter of those at home. That population would have to be 75% vaccinated for us to even come close to this number. Is that correct, based on back of the envelope?
Yes. I mean, if you do the math, that is correct. So the 5 to 11 population is about 105,000 people. We have about a 1.05 million population in Montgomery County, under 1.1 million in Montgomery County. So it almost is identical. About 1% of the total population is about 10% of the 5 to 11 population. Now, our total population vaccination numbers do not exclude anybody else who gets vaccinated. Now, that number is, has gotten quite low since our vaccination numbers are, amazingly high. It's not fair to say 75% of.
So it could be lower than that. It could be. It
could be slightly lower, but it's going to be in that ballpark because the number of 12 and older residents getting vaccinated within this time frame is just not a large number at this point, just because it's the law of diminishing returns. Unfortunately, there aren't as many people to continue to vaccinate who aren't 5 to 11, and obviously the county's overwhelming efforts are going to be focused on the 5 to 11 population that are newly eligible. So it is give or take that, but these are not exact numbers.
Got it. Yeah. So however we get there, if we can get to those census tracts where there's 40% of the population vaccinated and that goes up, whatever the age. Okay. So we get to 85%, and then the next day, this would kick in, and there would be no requirement for the masking. Okay. All right. I just wanted to be clear for myself, and I appreciate the work and everyone's contribution and the effort on this. I will support it as well. Thank you.
Councilmember Glass.
Thank you very much. I too just want to express my appreciation to Councilmember Friedson for putting this forward using a better metric that I think we can all agree upon. What I think is missing from this conversation, though, or actually, every Tuesday or every other Tuesday, we typically have the briefings with MCPS and with all of the doctors, and we had a brief conversation this morning, especially with our healthcare officers. But in order for this 85% to be achieved, we need to know the plan, right? And for the last year or last many months, we've all been pushing the county and our teams to make sure to go into those underserved communities, to try to coordinate with our schools, to coordinate with the health clinics, to get a near universal vaccination rate for adults. And we can't let up on that because this timeline is requiring it. And so as we have conversations week after week, while we'll be keeping a close eye on the total vaccination metric, we're going to have to make sure that the county operations across our vast government is doing everything it can to keep everybody healthy, safe, and get our kids vaccinated. And that there are possible instances that are going to be out of our control, supply chain, other issues, waiting for the governor to give us more vaccines, which hopefully is a different type of yo-yo situation that we do not encounter moving forward. But I am much more comfortable with this approach. I think everyone needs to see the light at the end of the tunnel, but it doesn't necessarily mean it will be an easy one. And so we just all have to recommit ourselves to the work that we've all been doing to make sure that we go into every community to make sure that every child is vaccinated so that we can resume some semblance of normalcy here. And so again, thank you, Councilmember Friedson, for the amendment, and I will support it.
Terrific. Any other comments on the amendment? Councilmember Katz.
My only question is, thank you, Council President.
Sure.
My only question is, when we're saying fully vaccinated, we're not talking boosters, right? Fully vaccinated is the 2 shots, right?
Yeah, it's fully vaccinated based on the CDC website. Based on that chart, the fully vaccinated number is actually just 2 doses. Or the single dose.
Or one for Johnson & Johnson.
Or exactly, the single dose Johnson & Johnson. So that's why we cited specifically the website with the data tracker. That is specifically what we will be using if this amendment and this amended regulation is passed. And as soon as the CDC reports on their website that number has changed, it will automatically trigger at 12:01 the following day.
Mm-hmm. Okay. Thank you. I think it makes a lot of sense. Thank you, Mr. President.
Okay. Is that everybody? Anybody else on the amendment? Okay. Are we good? Okay. All those in favor of the amendment, please raise your hand.
Mr. Hucker,
Yes,
excuse me,
all right.
President Hucker, we're going to take a roll call vote on this item.
Okay. Sounds good.
Thank you.
I think we,
On the amendment?
unless we do without objection, we have to take
Not
up
on the amendment, though. I thought it was
take
on
up the amendment, which I think should be a hand.
Right. Hands on.
Ms.
Right,
Singleton?
hand vote for the amendment and roll call for the actual regulation. Thank you.
Right.
Thank you.
Okay. So on the amendment, please raise your hand. Now it's unanimous. Great. Okay. On the amended bill, does anybody wish to speak? Okay, I'll just chime in at the end. I didn't speak earlier. Trying to be responsive to all the feedback we received and speaking to many of you, once was clear we had to address the Board of Health regulation, which I think, we didn't anticipate at this point. I reached out to many friends at the Maryland Department of Health, Prince George's County, USHHS, MedChi, the State Medical Society, the Montgomery County Medical Society, the Infectious Disease Society, and some of our excellent state lawmakers. It's not a perfect sample, but I was reassured to hear from every single one who each one lauded the county for our approach to date. They knew about our national leadership. None of them suggested we should remove the mask mandate in any short term. We all wish the CDC had clear guidance on this topic for local governments, but they don't. So I just want to reassure the public. We've received a lot of feedback. I chair the Board of Health, and I want to protect our process and our decision-making here. I want to reassure the public that we are doing the best we can with the information we have, following the guidance of our nonpartisan professional public health team. In a county of 1 million people, we don't expect everyone to agree. But there are 2 key milestones coming up. I mentioned some of this morning, but not everybody was tuned in then. When we passed this latest update over the summer, it was not clear when we would have a booster for elderly and immunocompromised residents, and it was not clear when we would have vaccines for 5 to 7-year-olds. And now we have those. And as an expert at the U.S. Department of Health and Human Services reminded me, milestones are very important in public health. Critics will cite our county's high vaccination rate compared to other counties, but there's a large segment of our younger population who are not vaccinated. And following the approval of the vaccine for 5 to 11-year-olds, it will still take several weeks after approval to get a majority of residents in this group vaccinated. We heard from the Council Vice President earlier about how hard it is to get an appointment. I checked a couple of websites this morning for my kids over the lunch break, cannot get an appointment to get them vaccinated. And getting to the place where we have our 5 to 11-year-olds vaccinated is critical to keeping our schools open for in-person learning without a new outbreak, which just reopened in September, and keeping them all open is a goal that we set then and we all share. There are also thousands of residents in our county who are fully vaccinated but still high risk and immunocompromised. And so they are at risk of getting seriously ill or losing their lives to any of us who are fully vaccinated but wander into a grocery store for a few minutes with them. So in public health work, my experts reminded me this weekend, milestones matter. We are nearing the holidays with people gathering inside more often. Critical to keeping our caseload down is getting our seniors and our immunocompromised residents their booster shots, which we didn't have available this time last year, and keeping our schools open. So I'm proud of this Board of Health. We've received a lot of criticism and even threats at times because we've taken a cautious approach. We follow the advice of our professional public health team throughout the pandemic. And I think because of that, we're performing better than the great majority of jurisdictions in this nation. And we're largely aligned again with jurisdictions with mask mandates nearby, including Baltimore, Prince George's County, and DC, all of which have a large number of Black and brown residents who have borne the disproportionate harm from this pandemic. So we will continue to take a cautious approach. We'll continue to follow our public health professionals' advice. And we may not be perfect, but we're doing the best we can with that information in a non-political, nonpartisan way based on the guidance that we're receiving. So with that, I don't have anything else to add. Madam Clerk, do you mind please calling the roll?
Thank you, Mr. President. Mr. Glass,
Yes.
Mr. Jawando,
Yes.
Mr. Reamer,
Yes.
Ms. Navarro,
Yes.
Mr. Rice,
Yes.
Mr. Friedson.
Yes.
Mr. Friedson votes yes. Apologies. Mr. Katz.
Yes.
Mr. Katz votes yes. Mr. Albornoz.
Yes.
Mr. Albornoz votes yes. Mr. Hucker.
Yes.
Mr. Hucker votes yes.
All right. Thank you. The amended regulation passes. Thanks to everybody who worked on it. Okay, next is item 8. This is an update. Mr. D'Andrea, thank you for joining us, and your whole team, I think, is here, and Dr. Bridgers as well. Item 8 is an update on MCPS COVID-19 health planning and efforts to address pandemic-related learning loss. I'll just say, to try to frame this, long before, there we go. Long before I knew we had to discuss the mask mandates today, and we'd spend so much time on that, I requested this briefing after reviewing the data regarding drops in math and literacy during remote learning due to COVID, especially affecting our Black and brown children. And this is known as the COVID slide. This relates to longstanding challenges we've had in this county and nationally, but we hope we'll never see those circumstances again. So let me first thank Chairman Rice and Essie McGuire on the council for putting this together. And let me thank Mr. D'Andrea and your whole team and Dr. Bridgers for all your work to address the COVID slide, which we're going to talk about for for much of the next hour. We know the pandemic has taken a significant toll on learning here and across the country. MCPS has enacted many strategies to keep our students safer so they can stay in school and the schools can remain open, and they've implemented many interventions to help close the gaps that have widened during the pandemic. Many members of the public have reached out to us to find out more about that, and I hope this briefing will help address their questions and their concerns. In addition to concerns about keeping kids in school, where we all know they learn best, we've heard a lot of concern from parents about learning loss. So I know all my colleagues are concerned about this topic. I thought it was appropriate for a full council briefing to hear an update from MCPS on the 5-point COVID response plan we heard earlier from Dr. McKnight when it was information, as well as the key COVID-related case data. We're also going to get an update on the recently released evidence of learning data, which strategies and interventions are being used to address the gaps that have grown during the pandemic, how MCPS is tracking the success of those strategies, and we'll review the timeline and the process on their efforts to monitor and report on student process as well. So colleagues, there's two parts. First on COVID health planning, second on COVID learning loss and recovery. I'll stop after the section on health planning to allow for questions, and then we'll move on to learning loss. Does that sound fine to everybody? Without objection, I'll move on to Mr. D'Andrea. Thank you so much for being here.
Good afternoon, President Hucker and council members. Thank you for the opportunity to provide some updates today related to the MCPS COVID-19 response. I'm joined this afternoon by Dr. Keisha Addison, Director of the Office of Shared Accountability, Mr. Everett Davis, Associate Superintendent for the Office of Student and Family Support and Engagement, Ms. Heather Dublinsky, MCPS System-Wide COVID-19 Coordinator in the Office of the Chief of Staff, Ms. Nikki Hazel, Associate Superintendent in the Office of Curriculum and Instructional Programs, and Ms. Stephanie Izzard, Coordinator of Student Health and Wellness in the Office of Student and Family Support and Engagement. Since we provided an update on key data points last week, and as a result of updated quarantine guidance from the state and the upcoming availability of COVID-19 vaccines for children ages 5 to 11, we modified our plan today to focus on quarantine guidance and vaccine distribution, along with a brief overview of the work of the MCPS COVID-19 Operations Advisory Committee. We will also share updates related to our efforts to address pandemic-related learning disruption. At the joint HHS and Education and Culture Committee meeting on Thursday, we will be discussing the medical officer position and more details about the COVID-19 Operations Advisory Committee. On Friday evening, the Maryland Department of Health and the Maryland State Department of Education publicly released new K-12 school and child care COVID-19 guidance. We have collaborated closely with DHHS to review this guidance and create new quarantine guidelines for MCPS. We are very grateful for the ongoing support from DHHS in navigating the complexities of this pandemic. As part of the updated guidance from the Maryland Department of Health and the Maryland State Department of Education, there are now modified quarantine options when students are, quote, exposed to students both correctly and consistently wearing well-fitting masks for all exposures. These modified quarantine options include test to stay, weekly screening testing, and correct and consistent use of well-fitting masks. Based on this new guidance, we worked with DHHS and shared some updated guidance yesterday. This morning, the Maryland Department of Health informed DHHS that test to stay cannot be used in circumstances where the exposure to COVID-19 occurs when either the infected student or the close contact is not wearing a mask. As a result, we collaborated with DHHS to make some additional modifications earlier today, and a press release will be shared with the entire MCPS community tomorrow. Our new COVID-19 quarantine guidance is broken down into two categories. The first category is cases where the infected student and close contacts are wearing masks during the exposure. In these cases, the unvaccinated close contacts must be enrolled in or must sign up for the MCPS COVID-19 screening testing program. As long as they consent to participate in the screening testing program, they can continue to come to school each day. However, they cannot participate in high-risk school-sponsored activities and are expected to still quarantine outside the school setting. Currently, unvaccinated close contacts in these cases have to quarantine for 10 days, so this is a major change that will reduce the number of students who have to enter quarantine. The second category is all other situations, including when masks are not worn or when the infected individual is an adult. In these cases, unvaccinated close contacts will be initially required to quarantine for 10 days, but can return to school after day 7 if the close contact submits a negative PCR test result taken on or after day 5 after exposure. Currently, unvaccinated close contacts in these cases have to quarantine for 10 days, so this change will allow the option to quarantine for a shorter period of time. It is also important to note that we are continuing to work with DHHS as well as the Maryland Department of Health and the Maryland State Department of Education to consider strategies to minimize quarantines when masks are not worn during the exposure, such as during lunch. As has been the case throughout this school year, this quarantine guidance only applies to unvaccinated individuals. Asymptomatic vaccinated students will not need to quarantine, as has been the case throughout the school year. We believe that these new changes will continue to keep our schools safe while reducing the number of students who need to quarantine. These changes will go into effect next Monday, November 8th. I would now like to briefly discuss the work of the COVID-19 Operations Advisory Team. This advisory group was formed earlier this fall and met for the first time on Thursday, October 4th. The team has been meeting every week since then and is designed to collaboratively provide input and feedback on topics, structures, and processes related to COVID-19, discuss the implications and create solutions for areas connected with COVID-19, plan outreach and identify communication structures needed in relation to COVID-19, bring forward recommendations to support the school district's efforts with all areas related to COVID-19, shape and inform district decisions about areas related to COVID-19, and guide the district's efforts in responding to COVID-19 throughout the year. To date, there are 3 collaborative focus areas of the COVID-19 Operations Advisory Team. The full team has broken into 3 subcommittees to focus on our Say Yes to the Test campaign, the Test to Stay program, and student vaccines. At the joint HHS and Education and Culture Committee meeting this Thursday, we will be sharing more details about the work of the advisory team and the collaborative focus areas. We are also very excited about the likely approval of the COVID-19 vaccine for children ages 5 to 11. As you know, this is a game changer for our elementary schools and will help to further reduce quarantine, as vaccinated individuals do not need to quarantine unless they have symptoms. We are strongly encouraging all of our families to get their children ages 5 to 11 vaccinated as soon as the vaccine is approved, and we have collaborated with DHHS to create a plan that we believe will help to expedite the distribution of the vaccine to children in this age group. I will now turn the presentation over to Everett Davis and Stephanie Izzard, our coordinator in the Office of Student and Family Support and Engagement, to discuss how we are collaborating with DHHS around vaccine distribution.
Good afternoon, President Hucker and all of the members of the council. I have a face mask on and I didn't know it would become a part of the discussion, but I'm supporting at one of our focus schools today, and I am going to respect the space here. And so I appreciate your patience, but I will speak clearly. I know you've seen this slide on the approach that DHHS has toward bringing around equity to the delivering of the vaccination and especially with our pediatrics group. I want to assure that this is consistent with the approach from our office, from our interim superintendent, and also our chief of schools, that racial equity was foremost the lens in which we approach this as an office and also as an individual. I speak from the voice of someone that survived generational poverty. So that is the lens I personally brought to this table. We go to the next slide, please. In our pediatric vaccination updates, we are starting off with 12 cluster sites, and those clusters are a little bit differently. They're being clustered by Title I and focus schools. Those are the schools that, as a system, we felt the need to ensure that those students had access. Not all students have access, but those were a group of students that we saw the need based upon data and the zip codes with our partners, DHHS, who were so helpful with guiding on the approach on where we should implement the pediatrics vaccination. As you notice, there's a little gap in between, so we are looking at to start at 6 major sites where the focus and cluster schools will be bused to these sites. And so for clarity on how that would work, our families are asked to meet at their home school, and our transportation system will pick them up and drop them off at the site. It will be an ongoing event from 10 to 6 on a Saturday or a Sunday, or whenever, again, the vaccine does drop. We can go to the next slide. And also, we wanted to ensure that we did do some focus area work during the weekday. So these are proposed week 1 site clinics. And those sites were chosen again. Form rate did play a part in that. Data from DHHS, but also the high walking. These are high volume schools with a high walking population. So even while we have the larger clinics on the weekend, we saw the need to also have this available during the weekday. And so we have partnered with DHHS, along with Holy Cross Hospital, and along with some of our partners from the Vaccination Providers Network, to ensure that those schools also have targeted approaches on their campus. So families will have choices on whether to be bused to the sites on the weekends, or there will be rotating sites throughout the week. Again, equity was the lens in which we approach all of this work. Next slide.
So good afternoon, President Hucker, council members, and thank you for having Ms. Izzard and I here today. It's a pleasure to represent MCPS as well as student family support and engagement around our pediatric vaccination updates. You have just heard Ms. Izzard outline our plan for ensuring that some of our youngest students, ages 5 through 11, receive their vaccinations, as well as the importance of this, as I heard President Hucker mention. As our team often says regarding family engagement, we have to meet our families where they are and remove any barriers that may prevent them from accessing needed services, resources, and supports. With this in mind, we are providing transportation access, and I know you heard Ms. Izzard speak a little bit to that. We are grateful for partnerships with both the MCPS Department of Transportation, as well as with our county government colleagues in transportation. Through this collaboration, we will ensure transportation to designated sites for families who need this support. By doing so, we want to ensure that all families who desire have access to the COVID-19 vaccination. Both the weekend school cluster sites as well as the weekday on-site clinics will offer a full menu of vaccinations. Next slide, please. Having just celebrated Halloween, as well as having 2 children in my own household, ages 6 and 11, who could benefit, I am excited about our theme, Vaccination Station, pulling up for our little heroes. We are hopeful to have all join our superhero squad. First, thank you to the many colleagues in MCPS, including Ms. Izzard, our coordinator for student health, for the vision, commitment, and leadership around these efforts, as well as to the Department of Health and Human Services, Holy Cross Health, and other healthcare providers, just to name a few, for their collaboration. Not only is it important to have a plan, but also to communicate that plan broadly. Some key messages that we'd like to convey are as follows. There is no cost to receive a COVID-19 vaccination. Also, parents are encouraged to check in with their pediatricians for appointments. Much as we have done with our MCPS community engagement efforts, and sticking with the theme of meeting our families where they are, we will hand out flyers directly to families in person through various venues where they frequent. We want to maintain a focus on hearing from credible messengers. These voices may include the schools and/or other trusted members of the community. Finally, we will use multiple media to connect with our families, including WhatsApp. In keeping with the theme of connecting for student success, We look forward to a rollout that will remove barriers, including those around transportation and communication, to ensure that, again, we are meeting our families where they are. Next slide, please.
As you noticed in our previous slide, it was more geared toward our kindergartners through third grade. We thought that we should have an age-appropriate flyer for our fourth grade through sixth grade. So that flyer will say, "Took my best shot. Are you ready to be part of the team?" And so we are reaching out to our fourth through fifth graders in elementary school, but we're not forgetting our sixth graders, and even if we have seventh and eighth graders in our middle school. So that's part of that middle school approach. After every student receives their first shot, they will receive a sticker that says, "I got my shot." Our goal is to ensure that every student, every child, and every caregiver who wants to get their shot, that we have access for them. Thank you so much for your time.
President Hucker, based on your introduction, we will pause here before we move into the discussion on learning disruption, if you would like.
Thank you so much, Mr. D'Andrea, and everybody on your team. I want to call on a couple colleagues, but I just on the first question, I got to say I'm a little confused by the presentation. I know we've been told that you're including vaccination. I'm getting a lot of texts from colleagues, so sorry if I missed something. I know I've been told, and much of the public have been told, that you're including vaccination clinics at, I thought, 37 elementary schools, which are, of course, the schools that 5 to 11-year-olds, of course, attend. And I'm glad that you're focusing on the census tracts with the lower vaccination rates, and glad to hear about the weekend hours. But I only saw middle schools and Ms. Izzard's presentation and a plan to bus to middle schools. Are you including elementary schools in the plan? And
yes, sir.
Which hours and when? Thanks. Can you? Yeah, I know we'll get a lot of.
I will pull back up that slide if it's okay. The one that shows.
Can you go back to that? Thanks. I know we'll get a lot of feedback about this. Go ahead.
Mrs. Clark, can you talk about the rotation plan?
Yes, I will. I'm going to wait for the slide to come up and then address President's question.
Right.
We up to that slide 9. If we can go up one more.
There we go. Week 1. One second.
No, if we go to the one that has all the middle school sites. Okay, there we go.
No.
So, sir.
Thank you. I appreciate all the middle schools and the busing plan. Can we go to the next slide? Because I was just asking
yes, sir.
Elementary schools, if you don't mind.
Yes, sir.
There we go. Okay. I think we didn't spend much time on that. 1, 2, 3, 4, 5, 6, 8. 13 elementary schools are on here, including a lot in my district and Gaithersburg and Germantown and Wheaton, Aspen Hill. Great. Okay. This is what we've been asking for and a lot of constituents been asking for. I heard Mr. Davis say over and over, you're meeting people, families where they are. So I think this is a good step in the right direction for sure. Yeah, please go ahead. Sorry.
Yes, sir. All right. And so, as you know, on week 1, that will be the starting point. Week 2 will be another series of in focus schools that have a high. I love it. Councilman Rice is shaking his head. Awesome. That has a high volume of walkers also. And then we will go to the third week and rotate to another high volume of walkers. Then on the fourth week, we go back to week 1 to get their boosters and to allow for new folks to receive vaccination. So it'll be a rotating basis. So on the weekends, the elementary schools will be bused to those middle school sites because those sites are a little larger, especially because it's getting colder. We may have to do these inside. But the largest piece I'd like for the takeaway is we added that extra layer that we've been waiting to roll out to you to show that we're going to be on these sites, especially some of these are highly impacted sites, high volumes of walkers. And those are the trends you will see. And again, as I always like to quote the historian, Ross Geller, we will pivot when we need to. And so we will go by the data to pivot.
Okay, well, that's good to hear. I think this is a great start. I know we have something like 35 Title I schools, and I'm counting like 13 or so on here. And I know, by contrast, DC has provided their plan to the community last week for vaccinating this age group with sites at 35 elementary schools. And they're obviously a much smaller jurisdiction than Montgomery County. So I'm glad you're moving in this direction. I hope you'll continue to move in this direction. I would give up some of the busing to middle schools in favor of, if you want to meet the families where they are, they go to the elementary schools every single day, and many of them walk there. I also just want to add, I want to get to colleagues, but I want to ask also, we've heard so much from teachers and support staff that they need to be able to focus on attacking the gaps that grew during the pandemic. We talked about this in health briefings. Can you talk about how MCPS and DHHS are working to ensure school staff are not tasked with public health duties? I know there's a staffing shortage that I know a lot of smart people put a lot of time into addressing. I think 45 contract staff are being hired to complete these duties in highly impact schools. But even last week, there was a picket at Carver. We have a lot of frustrated teachers. We can't afford to lose any more of our teachers and support staff who are, being telling us all the time how thinly stretched that they are and how much free time and planning time they're having to give up. So I want to give you this opportunity to talk about how all schools are being equitably supported in this area.
I can start and share a little bit, and then I'll ask Mr. Blinsky to talk a little bit about the contact tracing work and how we are partnering with DHHS to support that. But one thing that I do want to acknowledge before going into that is with this new quarantine guidance, this should reduce the number of students going into quarantine, which will reduce the need for quarantine instruction. We know that teachers and all school staff have been working incredibly hard this year to support students in a variety of ways as we transition back to having our buildings at 100% capacity. And at the end of the day, one of the key areas of concern has been the amount of planning time teachers have given up to be able to provide that instruction for students who are in quarantine. So anything we can do to reduce those numbers, that is one piece of the overall puzzle. And we're obviously very hopeful that the numbers of cases continue to stay low as we move into the holiday season. I'll ask Mr. Blinsky to talk about, if she doesn't mind, the work around contact tracing and the steps that we take partnering with DHHS to try to reduce the burden on school staff.
Thank you. Good afternoon, Council. As Dr. McKnight said in her 5-point plan, one of the points was to hire additional contact tracing support to work in schools and provide support to school staff and principals to take that duty off of their plates. We have onboarded and deployed 16 contact tracers. They are assigned by a cluster model. And even though we have more clusters than contact tracers, we're thankful that they are able to provide supports, even if they're not dedicated and assigned to the cluster. So anytime a school has a positive case, we deploy a contact tracer, or I'm available to support on evenings and weekends. And we work with the principals to identify the close contacts and assist them with making phone calls and sending out communications to parents, notifying them of their child's need to quarantine. We are so thankful for our principals and our teachers because even with the contact tracers, we still do rely on the information they provide because they are the ones in the classroom and can advise on who has had that close contact. So it is a collaborative effort. And again, we work with our partners in school health services and Department of Health to complete line lists and get that information to the health department in a timely manner. And it really has seen improvement in the amount of time that our principals and teachers are spending on COVID-related activities.
Thanks. Two quick housekeeping things. You announced new quarantine guidelines at yesterday's presser. When will those be posted and distributed to families?
That will occur tomorrow. We did have to make one slight adjustment after they were announced yesterday based on a clarification that came from the state this morning around the use of test to stay in cases where students are unmasked, like at lunch. But that is all planned to be posted officially tomorrow and released through a press release as well.
Thanks so much. And this was brought to my attention last week, and I brought it up. I think the dashboard, again, still shows 0 active cases and no quarantines. So you might want to take a look at that.
So we have followed up on what the issue was there. So the data was being updated. New data was entered into the dashboard once a week based on the data from the prior week. But the way that the algorithm had been written by our programmers was that after 10 days, the cases and quarantines rotated out. So if a case was entered in from October 16th, it rolled out automatically as part of the computer algorithm and no new data was inserted. So we are working to change that so that all the data is static as of the date of the update.
Got it. Okay, glad you're working on it. Thank you, Councilmember Novato.
Thank you. So I guess as I'm hearing about the report, which I really appreciate, especially the plan in terms of using the schools in the elementary schools. But I am reminded of, how our school system, of course, is the epicenter of the community. And so when we were in the throes of the pandemic and we made a decision last summer to design and fund two particularly targeted initiatives, right? So Salud y Bienestar for the Latino community and then the African American Health Program for our Black community, because we understood that that's what equity is about, right? It means that sometimes you have to make sure that you have targeted interventions and you have to adapt them to the needs of the community that you're addressing, especially in this case, because it's life and death, and we funded those initiatives. And so I'm just curious if there have been any conversations with our HHS department, the school system, now that we know that we have achieved an incredible milestone with vaccination rates in the Latino community and our Black community, but now that we're then shifting to our student population, which of course mirrors the rest of the population because these are the children of those folks that we served, have there been any conversations about perhaps figuring out how to adapt that same model with the same partners and going in a very grassroots way to figure that out? I mean, do we have an opportunity here to maybe implement a version of Salud y Bienestar, African American Health Program, but directed now in our younger population, working with the parents? Has that been at all considered?
May I speak? I will speak to that. We are working with the Vaccine Providers Network, which consists of some of the folks you just named. I'm so sorry, announcements are coming on. And that includes MCPTA, the Black and Brown Coalition, Food Hubs. What we're doing is we have been meeting with them on Wednesdays. We meet with them on Wednesdays, and part of some of these are also on our COVID-19 committee. Right now, Byron Johns and Cynthia Simonson have been supporting the work of spelling out where volunteers are needed. They've been a great support behind the scenes helping, but also within those spaces when we meet. So we're seeing that grassroots effort that needs to take place because we saw what happened with the onset for adults. We're not only trying to replicate it, but elevate it. And so we're starting this at a quicker pace than probably at the onset as we were all figuring this out, but we are working with our partners. I think as you will see, as we continue to unroll, you will see the connectivity between all these groups, because our purpose is, as stated, to give access to all who need access.
So Councilmember Navarro, if I may just add one point, thank you to our MCPS partners and to Ms. Izzard, who indicated that we do meet on Wednesday. But one of the questions that we've had on the public health side is cultural appropriateness, whether or not our clinical providers are aware we have a younger population to vaccinate a younger cohort. And we've been reassured that all our clinicians understand, how important it is for parents to not only be involved, but to understand how our children feel about getting vaccinations. The Maryland Department of Health identified our pediatric providers, but we have clinical providers that we've been working with very closely, and all are aware and are being reminded that we have a very culturally sensitive population, culture to receiving shots, culturally sensitive to being in an environment, especially in a public setting, that may be uncomfortable to them and their parents. And we work very hard and diligently with MCPS to make sure that these are respectable, trusted, and safe spaces. So I just wanted to add that piece to the conversation.
I appreciate that. The reason I bring this up is because, as it was stated, I know that our teachers and principals have had to wear many hats, additional hats during this whole process. And I think that has, of course, impacted this notion of the COVID learning slide, and rightly so. And so the fact is that if we've reached a very important milestone in our Latino community, in our Black community, in terms of adults, I think that same template, including funding that we may have to also assign, that same template can be adapted to our school system, because these are the children of the adults that we address through Salud y Bienestar and the African American Health Program. And so if we've succeeded there, why not figure out a way? And I'm talking about, we have the health promoters, for example, that can go out there and do this kind of work. That would also provide some relief to our teachers and principals, because there's just this trained cadre of community partners and clinicians and grassroots health promoters, et cetera, that did an extraordinary job in getting our adult Latino and Black community vaccinated, and effectively closing that gap. And so why wouldn't we look at, being innovative in the same way with our young people, with our students, knowing that this is now our next challenge. So I know, of course, that there are a lot of, legal issues to consider and the confidentiality and all of that. I mean, I used to serve on the Board of Education. I'm really familiar with all of that. But I think it might behoove us to just even entertain an exercise to see whether there is an adaptability that can be transferred from those two particular initiatives now that they've reached such an incredible milestone. See if now we can pivot some of those activities to our young people. And again, if we need to invest additional dollars, then we should do that. I mean, it was extraordinary what this council, in collaboration with our HHS department, was able to do to get us to the point, where we are. Looking at who our students are in Montgomery County Public Schools, I believe there's 72% of color. Obviously, we don't have a lot of time to plan or just think through this issue of disparities. They are there, they're present, and we have two, award-winning initiatives with great results. So I just offer that. Would be really, really excited to see how we could perhaps support some, a similar approach with our students, and hopefully be able to then pivot so quickly that we can celebrate, the milestones that we've celebrated with our adult population in our Latino and Black community. So if we could have an update, perhaps, next week or something like that, to see if there's any opportunity to do that. I know these partners are eager and they're ready to step up. And again, I think it would provide extraordinary relief to our teachers and principals and other staff that have had to do a lot of additional work on top of their academic instruction and other support services.
Mr. Dandry, does that work for you?
We can definitely collaborate with DHHS on providing an updated our next MCPS briefing.
Sure. Yeah, we'd always, if Councilmember Navarro prefers an update next week, we should just get an update next week, I think. And it doesn't have to be a perfect update. It should just be a current, timely update. We know you're working on it every single day.
Absolutely. We're happy to do that.
Thank you so much. Chairman Rice.
Well, thank you very much, Mr. President. And first, I just want to remind folks that we have a joint Health and Human Services and Education and Culture meeting on Thursday. And so we'll be talking about and updating even more so about some of those health initiatives. I did just want to make sure that folks are aware, and I want to thank the Healthcare Initiative Foundation. They are working with the school system on actually expanding 10 additional sites beyond what we have currently. So, Mr. President, to your point and to Councilmember Navarro's point, when it comes to the continued expansion and working together with the community, the Healthcare Initiative Foundation has been right there and focusing on some of those healthcare inequities that we continue to see in our community. And just really want to thank them for their continued partnership. Where we strategically place those is, I think, going to be one of the things that is where the rubber meets the road. And so I think that, again, having those large and highly impacted elementary schools certainly is a priority. You've heard that from a number of my colleagues, Mr. DeAndrea and to Dr. Bridgers. And so we certainly want to try and coordinate around those efforts of getting the biggest bang for our buck and to not have to re-replicate the things that we've already done, right? So, or we want to replicate the things that we've already done in terms of establishing those relationships that are there and certainly building off of those with continuing with the great work of our hubs and our folks in the community, our paras that are out there. We will need to make sure, and speaking of paras, we will need to make sure that there's assistance provided for those in the community. As you heard from Councilmember Albornoz, and you heard from, Council Vice President Albornoz and Council President Hucker, when it came to them trying to set up appointments for their own children and realizing that they couldn't do it here, couldn't do it there. Many of our parents are going to need assistance, and those are the ones that we're going to need to prioritize when it comes to ensuring that they get the vaccination because of heightened risk, not only for them as individuals, but then also for their greater family structures, knowing that many of them may be immunocompromised, have other kinds of health conditions in the household that proliferate many of our communities of color. And so from that perspective, there's a need for us to make sure we're doing all we can to prioritize those particular sectors. And then last but certainly not least, when it comes to transportation, that's another thing that we'll need to continue to talk about, working with our Department of Transportation that has developed some robust ways in which we've been able to get folks to vaccination appointments. I want to remind folks of what our Department of Transportation has stood up for county residents as a whole. So that will apply to our parents trying to get their children vaccinated. They don't always have to ride the ride-on bus, although that is free. There are other ways and other methods in which we can call. We need to make sure that our school system has all of those and that they're being communicated to parents as well to avail themselves of these programs if they need to. Again, it's very convenient to have something that's walkable, but we know that we're a large county. We're spread out. Not everybody's going to have that walkable situation. And so from that perspective, all the other ways in which we can connect our parents and those and their children to be able to get to those areas for vaccination are going to be tantamount. So again, you guys have done a great job in terms of standing up in a short period of time. What's there? You hear the impetus from us. You saw the conversation we had earlier. There's so much dependent upon our children from that 5 to 11 cohort being vaccinated. It does give the county the ability to really start to move forward. So there's a lot of pressure that is on you right now. So I appreciate and understand that that may be difficult, but at the same time, we want to help you. And so as you heard from Councilmember Navarro, whatever support it is that you need, whether it's financial, whether it's procedural, all those kinds of things, just let us know so that we can continue to work together as partners to really get to that end goal. So thank you, guys.
Well said. I don't think of it as pressure. I think of it as an opportunity to keep all our kids safe, and we're definitely here to help. So please stay in close touch, which is what today's all about. Councilmember Friedson.
Thank you, Council President. First off, thanks for raising. I was going to mention the 0 number on the dashboard, which would be great. It would make us all excited, but obviously it doesn't seem to be the case. I didn't hear though the timeline on fixing the algorithm there, and perhaps I just missed it. I know there's some data input issues that you're working through, which I understand, but do we have a timeline of when folks should trust that the data on that dashboard is actually accurate?
That should be fixed within, I would say, by the end of next week at the very latest. We're working on that now. The data that's in there is, there's been manual checks of all the letters versus the case reports to make sure all that's accurate. It's about the piece of how it's tabulating the active cases and active quarantines. It doesn't impact the overall totals. So yes, we're working to get that addressed, and that should be hopefully even sooner than that, but I would say by in the next week at the very latest.
Appreciate that. Is there a way to get like a disclaimer or some notice so that residents understand that in a public way?
We can definitely add that to the dashboard, a statement about that right now until it is corrected.
Yeah, I think that would be helpful, just so when folks go check it out, they're not listening here, they'll understand that issue and the general timeline. Thanks for that. I have a couple broader questions that I'll get to, but the new categories that you mentioned regarding the new quarantine policies, and I know that that's based on making contact tracing more accurate, but is there any concern that'll make it more difficult for, what we've talked about here quite a bit is already a stressed system, in terms of like resources and capacity? Do we think that the changes, as you've noted, will have an impact on the capacity to implement?
It's hard to predict exactly the overall net impact. Obviously, as we noted earlier, the fact that there will be a significant reduction in quarantine instruction obviously is one area where that will free up time that has been taken typically during planning or by staff who are released to focus on providing support to reading or staff development to be able to, that have been previously using that time to focus on quarantine instruction. In terms of the other pieces, we are working on, internally how we can streamline the processes as much as possible for schools. We will continue to make sure that close contacts are notified that they are close contacts. Even if they already signed up for the screening testing program, because in essence, if that's the case, there really aren't any other steps other than them being aware. If they're not currently signed up, then we've got to make sure that they do sign up. And families always have the option to say, I would rather my student quarantine. We would absolutely respect that. We know that that's probably a small number of cases, but we do anticipate that happening in some cases. So we'll continue to monitor. This will start next week. We'll be closely monitoring the overall impact. And then, at the end of the day, working to target supports where they're needed. We're very happy, though, about the opportunity to have, our goal all along has been to have students in school safely, and, to have the, reduced quarantine numbers to the greatest extent possible while making sure safety is the top priority.
Got it. Thank you. So I have a couple of questions that may be more related to DHHS than they are necessarily MCPS, but the guidance and forthcoming test to stay pilot that you're working on and have discussed, how does that impact non-public schools, and how is that information being communicated? I understand there was a webinar that was planned for Friday that couldn't be accessed by some of the stakeholders. There's some concerns raised of their access to it vis-a-vis MCPS, and could you give an update on that? I don't know if that's for Dr. Bridgers or somebody else in the health team.
Councilmember Friedson, we had the original non-public school webinar that Dr. Stoddard and I have reinstated on a bi-weekly basis. We have rescheduled that for, I believe, this coming Thursday afternoon. We have provided them with the guidance. We are reviewing their test to stay pilot. The way it works is that the guidance the guidance is recommendations, and so as they look at those three additional modified quarantine strategies, the test to stay, the weekly screening, and the constant and consistent mask wearing for those individuals who are asymptomatic, we will have a discussion on Thursday. They have the information about it. They are open to craft the modified quarantine based on their population needs, which is slightly different than MCPS, who is compelled to follow the guidance from MSD and MDH. I had a conversation earlier this afternoon about some of the questions that Mr. DeAndrea and his team asked me about the quarantine and how that applies to those high-risk areas that Mr. DeAndrea talked about. Conversely, those non-public school settings have a little more flexibility in how they interpret and how they set the guidelines for that. So we'll be having a conversation on Thursday afternoon, Dr. Stoddard and I, where we will walk through and answer any questions that they may have regarding the new MSDE MDH guidance.
Appreciate that. So just so everybody here understands, because we're getting a lot of questions about this, there seems to be some confusion about the powers that the independent schools have vis-a-vis the health officer and the health department. I think previously they were told that they had to follow, these weren't guidance, it was, requirements, it was directives from the health department. Some have interpreted that differently moving forward? Is it one or the other? Do the independent schools have to follow what the health department has suggested? Can they just choose one of the three options that that MDH has put forward at the state level? There seems to be a lack of clarification on that. I'm sure you're going to clarify that on Thursday when you meet, but I think it'd be helpful for all of us to understand, because there are a number of questions about the quarantine policies and the isolation requirements and other dynamics there.
So thank you again, Councilmember Friedson. These are recommendations where the MSD and MDH are recommending based on how the CDC define quarantine guidelines, be it 14 days, 10 days, or the current 3 modified quarantine approaches that are predicated on those individuals who are unvaccinated and who have had a close contact. The only, per my understanding and conversation with our legal team is, and based on COMAR regulations, the health officer and or his or her designee will issue an order if individuals who are quarantining don't follow those quarantine guidelines if they have been identified as a close contact. That is the only mandate as set forth. The other guidelines are recommendations, and similar to MCPS system guideline, it's slightly different because they follow the guidelines and regulations as set forth by the Maryland State Department of Education and their Board of Ed. So that's the difference.
If we could clarify what the rules are and what they're responsible for, what are requirements and what are recommendations. I think there's a lot of confusion from a lot of parents and a lot of these school administrators. I think they've heard some mixed views on whether these are orders that are enforceable criminally and civilly, or and whether they have strict penalties, or whether this is health guidance that they are being provided recommendations that they can then implement. We're hearing a lot of consternation related to that. I'm sure a lot of it will be clarified on Thursday, but in advance of that, if we could get real clarity here, something in writing of what the rules are, who's responsible for what these different things mean, I think it would be helpful for all of us. And if it could be distributed to the council members, I think it would be helpful, since I think several of us are hearing from a number of parents in a number of these schools who they want to know what the rules are and what they're supposed to be doing, what they're supposed to be following. Just lastly, we had a question related to the independent schools, that they were told that they can't be on the county's distribution list when it communicates to non-public school personnel, because they're not officially school officials. They don't actually work at schools. They represent the people who work at school. I can bring this offline, but it seems to me that if we have people who are representing and communicating with and ensuring that we're disseminating information to those who work at schools, that we want them to be on our communication list to make sure that these types of misunderstandings don't happen. So just want to check to see if they could be added to that, and we could
I'm not familiar with that,
communication a little bit better.
Yeah, no, I'm not familiar with that part, but let me just go back. I know at the break, Dr. Stoddard and I had some conversations, and I think I know he responded based on our conversation with your question as far as the delineation of the breakdown. But if there's additional clarity provided, please let us know, and I will have our team work with it. I know we work extensively with a letter of approval committee that will meet at 8 o'clock in the morning, as well as with Ms. Kinch, who provides the legal advice, which set forth what's in COMAR and the mandates, et cetera. So we could put something together for you and the council to review and have.
I think that'd be great. Well, thank you very much. If you could, and the team could look into the communication list. I think getting everybody on the same page is, you said, the level setting, and you're building on the level setting to
get us all on the same page.
On the same page, which we appreciate. I think that would be a good step in that direction, and appreciate that. And we'll yield back to you, Mr. President.
Will do. Thank you.
Thank you, Councilmember Reamer.
Thanks. Yeah, I wanted to see the explanation of the new quarantine policy on the screen. I thought it was, if you could, Mr. D'Andrea. It's As a
Yes, definitely.
parent of a kid who's just starting his quarantine today, I wonder if my kid will be able to go back to school. But I know a lot of people are interested here. So as long as a parent has consented to participate in the screening program, they can go back to the school the next day.
As long
they
as
are
the
masked.
right, as long as the exposure happened while they were wearing masks. So there would be situations, if the exposure happened during lunch where this does not apply. But even then, there's the possibility for the quarantine to be shorter.
So you'll be able to contact trace who sat with who at lunch.
I can let Ms. Dublinsky talk more about the work that she does to guide schools and work with our contact tracers.
Thanks.
Yes, that is part of our contact tracing work is identifying students who are in close contact, less than 3 feet in the classroom, less than 6 feet at lunch. And we take into account those other high-risk areas, any close contact that occurs during indoor PE class where there's high exertion activity, or in music classes where mouth instruments or singing is occurring. So we can really drill down to identify the close contacts and those whose contact may be eligible for modified quarantine options.
Okay, so under current policy, is this going to reduce the number of children who are quarantined significantly?
Absolutely.
Yeah, because under current policy, I think a lot of whole classes are being quarantined, right?
Classes are being quarantined when it's been identified that there has been close contact among all the students, or especially if the staff member in the classroom is positive, because the guidelines for a staff to student exposure still remains 6 feet or less. So when there are times when that 15 minutes of close contact has occurred, there are times when the full class has to quarantine. But again, we'll continue to drill down to find when that close contact occurred, and any of the contact that happened when a mask was worn during the entire period of contact, they would be eligible for the modified quarantine.
We do anticipate that the number of students who need to go into quarantine will be reduced, at least initially. As I mentioned just briefly earlier, obviously we're very hopeful that the number of cases stays low as well as we go through the holiday season, because we know that's a big variable in terms of Thanksgiving travel and things like that.
Right. Okay, thank you.
Thank you. Anybody else want to get in on this? Or if not, we'll move to learning recovery. Thank you all. This has been very helpful. Mr. D'Andrea.
All right, thank you very much, President Hucker. I will now turn it over to Dr. Addison and Ms. Hazel.
Thank you and good afternoon all. Jimmy, if you could go to the, yes. Thank you. So I will be sharing with you our evidence of learning results from the 2020-2021 school year. I would like to start by providing you with a general overview of the evidence of learning framework. The framework was initially developed during 2016 and is a multiple measures approach of helping us answer the questions, are students learning and are they learning enough? The evidence of learning framework uses multiple measures, meaning classroom measures, such as course grades, district measures, which are curriculum assigned assessments, and external measures, such as the measures of academic progress assessment or MAP assessment, as well as state assessments. And they are used to assess student learning and inform instructional decisions. We indicate that a student has met evidence of learning attainment if they meet at least one measure within 2 categories. For example, classroom and a district measure, district and external, or classroom and external. At the end of the school year, we report on our readiness grade levels, which are grades 2, 5, 8, and 11. And these are the grade levels prior to a student transitioning to the next level. And again, we ask the question, are they ready for the next grade level? Next slide, please. Here we transition to the evidence of learning attainment in mathematics. To acclimate you to what you are looking at, there is color coding associated with each grade level. Grade 2 is represented in green, grade 5 represented in salmon, grade 8 in yellow, and grade 11 represented in blue. Results are reported for all students at the grade level and then for the student focus groups, which is across the bottom or horizontally, and services, which is down the right-hand side. To walk you through one, let's focus on grade 2. So overall for grade 2, 63.8% of students met evidence of learning attainment in mathematics, meaning 63.8% met measures within at least 2 categories. Again, classroom and district, district and external, or classroom and external. Across the student focus groups, you can see that 87.5% of grade 2 Asian, white, and all other student groups not receiving free and reduced price meal system services or FARMS services met evidence of learning attainment in mathematics. 70.3% of grade 2 Black or African American students not receiving FARMS services met attainment in mathematics. 63.5% of grade 2 Hispanic Latino students not receiving FARMS met attainment in math. 57.3% of grade 2 Asian, white, and all other student groups receiving FARMS students met attainment in math. 46% of grade 2 Black or African American students receiving FARMS met attainment in math. And 34.6% of grade 2 Hispanic Latino students receiving FARMS met attainment in math. For grade 5 students, percent attainment in math ranges from 18.9% for Hispanic Latino students receiving FARMS services to 79.1% for Asian, white, and all other student groups not receiving FARMS services. For grade 8, percent attainment in math ranges from 28.1% for Hispanic Latino students receiving FARMS services to 84.5% for Asian, white, and all other student groups not receiving FARMS services. And for grade 11 students, percentages range from 32.7% for Hispanic Latino FARMS students, Hispanic Latino students receiving FARMS services to 82.7% for Asian, white, and all other student groups not receiving FARMS services. Next slide, please. Now we transition to evidence of learning attainment results in literacy. Again, there is a similar layout with results available for the overall grade level and then disaggregation by student focus groups and services. Overall, 47.5% of grade 2 students, 57.6% of grade 5 students, 69.3% of grade 8 students, and 69.8% of grade 11 students met evidence of learning attainment in literacy. Similar to what was observed in mathematics, percentages varied by the student focus groups, with the lowest percentages observed for Hispanic Latino students receiving FARMS services, and the highest percentages observed for Asian, white, and all other student groups not receiving FARMS services. I will now turn it over to Ms. Hazel, who will share the focus to address these areas.
Thank you, Dr. Addison, and good afternoon. If you can go to the next slide, please. I want to start by saying that certainly we acknowledge the data that Dr. Addison shared is alarming, but we have been planning for the instruction of these students for several months as we've been reviewing the research and data trends across the country and across the world, and have really been studying the impact of the pandemic on our students. The Office of Teaching, Learning in Schools has been really working very hard, and we have put together 6 areas of focus that we will share with you and that we've shared with our Board of Education and school community. These areas we will be working on throughout the school year: school improvement planning. We have a focus on literacy and mathematics. We are focused on assessment for and of learning, focused on acceleration of learning, and we also have tutoring and intervention supports. So if you can go to the next slide, the 6th area is our professional learning. I think that got cut off. If you can go to the next slide, please. Thank you. So all of our schools are expected to put together a school improvement plan. And that school improvement plan for all of our schools this year, the goal will be for our students to be on or above grade level in literacy and mathematics. So that is something that we want based on the data that we see at the district level. We know that we have a lot of work to get many of our students back toward those grade level standards. And so all of the school improvement plans will aim towards that goal. They are expected in their schools to review their individual school data, as Dr. Addison said, multiple measures, grades, report card grades, district assessments that are aligned to the curriculum, and our external measures that include tests like the measurements of academic progress or MAP, or some of those other external nationally normed assessments. So they review that data, they monitor it, they look at trends within their own school, and they also identify specific students that they have identified as needing additional support. They also identify what the professional development needs will be for their staff to meet the needs of their students. And our goal for all of our schools is to accelerate that learning experience for students so that they can get back on track. And I'll talk a little bit more about that in a little bit. If you can go to the next slide, please. Our next area, again, talking about literacy and mathematics focus. For mathematics, we really have been spending a lot of time addressing the unfinished learning that occurred last year in the virtual environment. Out of all the content areas, this is the area last year that we heard the most feedback from our parent community, our school community, even our students. Mathematics was the area that they felt in a virtual environment was particularly stressful. The pace was a little too fast. And so we had to make some adjustments in the curriculum office. And now it is our role over the next couple of years to address that unfinished learning and ensure that there are built-in foundational days, that we have some flex days, and that there's a level of differentiation that occurs within the classroom so that we can ensure all of our students have those foundational skills met. We also have been really focused on professional learning. Many of you may know that we implemented new curriculum right before the pandemic. And so for some of our schools, they implemented the curriculum for the first time during the pandemic. And so we have been working very hard this summer and now during the school year to provide professional learning, what we call macro training at the district level, and also going in school by school to provide the macro learning for staff around the implementation of the curriculum and particular focus on students in certain service populations, our English learners, our students who have limited or informal education. And we also have a special focus on meeting the social emotional needs of students while delivering curriculum. And we also don't want to forget those students who did not experience loss. We have students who need to continue to be enriched throughout this process. And so we have also kept them in mind as well. Next slide. In our English language arts, the focus is really, again, building foundational skills, but as you saw through the data that Dr. Addison shared, our primary students were most significantly impacted by the pandemic. And we believe that learning online and teaching foundational skills, what I mean by foundational skills is that phonics, phonemic awareness, decoding, all of those things that you teach students, that building those skills to read are difficult to do in a virtual environment. And so we do attribute some of that loss to learning virtually and learning those types of skills. And so we have really focused this year on building those skills. We want to ensure that we have built in more time during the instructional block to make sure that foundational skills are being taught. We want to make sure that our teachers are using grade level text to instruct our students, that there are small group instruction taking place at both the primary and secondary level, and that we are using assessment to really monitor how students are doing on a regular basis. So that's going to really inform where teachers take their students next. So that data-driven instruction is really critical. And they are also really focused on an anti-racist, anti-bias literacy lens as they are thinking through the materials that they're using, and just, again, being culturally sensitive as students return back into their classrooms. Next slide, please. The next area is assessment of and for learning, and assessment of learning really at the district level or at the school level, looking at how students did overall. But really where we're focusing our attention with our teachers is that assessment for learning. How do you take the assessments, those informal checks, day to day, and really make sure that you are making decisions about the next instructional move? And so you can see on your left-hand side what the middle school calls the cool down, and on the right-hand side, what the elementary calls the exit ticket. Both of these are examples of questions that students are asked. They're both asking students to explain either their own thinking, or in the case of the middle school, they're explaining the thinking of the student who completed the question. And that really gets to whether or not students have a deep level of understanding with the mathematics. And then it also really informs the teachers. Teachers can use conferences. They can do these informal quick checks. Lots of ways that they can collect information that are directly aligned to what they're teaching with the curriculum, so that when students get that district assessment, they will be prepared for that grade level, the grade level questions. Next slide, please. So the other piece of information that we've really been studying the research around is this idea of acceleration of learning. We often think that the best strategy for students who are struggling is to remediate them. And the research is saying that's actually not the case. And that schools and school districts that continued with those grade level instruction and accelerated the learning actually saw more gains during the pandemic than those that remediated. And so we are really focused on supporting our teachers with teaching grade level content and going back and filling in prerequisite skills based on need. And how do we know when a student needs it? Based on those informal data checks, and also based on those pacing guides that our teams have created for our teachers. So they can determine what were those prerequisite skills. Well, we've provided that information for them, but also what else might they need? Well, the data is going to tell us that day by day. So we in the curriculum office and school support and improvement are working with teachers on a regular basis with their planning to help them with that grade level content planning and instruction so that we can accelerate the learning. And hopefully our goal is that we will see students move towards those grade levels once we get to the next assessment data point. Next slide, please. We recognize that not all students are going to be in the same place. We recognize there are going to be students that will need additional support. So we are addressing the additional support in two ways. So if we go back to that last slide, acceleration of learning, we want everyone learning at grade level standard, but we recognize some are going to need another dose of instruction around that same content. So we have high dosage tutoring. That's a boost, if you will, for students to get back on track. Grades, report card grades might indicate students need additional tutoring. Students may not have been engaged during the virtual instruction, and so the teachers may have noted they need an additional boost. The tutoring will occur through additional funding that we have received either before school or after school. We're starting virtually now until we can get our transportation and other things more stable and up and running. And we will be providing tutoring for students in very small groups of 1 to 3, no more than 5. Tutoring can occur with our classroom teachers or our paraeducators. And we are also hiring external vendors to support us with the tutoring for those schools that are struggling to find staff. Our goal is to go to the Board of Education next week with to get approval for the vendors that we have selected through an interview process. And we would like to get the vendors up and running, trained using our curriculum as soon as possible. but tutoring has already started in schools. We do have, as I said, some schools that are still working to get their staffing. And we hope to be fully in operation in the next couple of weeks with all of our schools. For those students that need even more support than tutoring, there are very specific skills in literacy or mathematics that they're really struggling with. We will provide them evidence-based interventions. So MCPS, along with our curriculum and special education office, we collaborate together to identify evidence-based interventions that schools may use. We train all of our staff on the use of those interventions. We purchase the materials for them, and those interventions can be used before, during, or after school. Again, paying staff additional stipends to support the students if they choose to do it before or after school. We expect all of our students who are in interventions or tutoring to have a pre-assessment and a post-assessment. We expect the data to be collected in our MCPS portal so that we can monitor it. And we will be reporting back on a quarterly basis how our students are doing in both of those interventions and tutoring, and monitoring through the evidence of learning process as well. Next slide. And the last is professional learning for the district. We are really excited that we have a new assistant chief of professional learning this school year, and we have been working very closely with her to develop a professional learning plan for the district that is related to these areas that I just shared with you. And so we are going to be working not only with our central services staff, our school leaders, and our teachers around building the capacity to teach those grade level standards, to also really be able to monitor student performance through the use of informal assessment. So I will stop at this time for questions.
We'll turn it back to you, President Hucker.
Oh, thank you so much, Mr. D'Andrea and Ms. Hazel and Dr. Addison and Ms. Duplinsky. That was terrific. Couple quick questions I have, and I want to turn to colleagues. This is, I know everybody's working very hard on this, but the data are alarming. Taking a step back, what are the national best practices in this area? Are there other jurisdictions that are pursuing more innovative strategies that have been effective at addressing learning gaps elsewhere?
Yeah, so one of them, that concept of accelerating learning and not the remediation, I think that is really critical. And again, looking at the tutoring and intervention, they call it high dosage tutoring so that it's happening more than just once a week and not in large class sizes. So that is an area. And then really focusing on how you take informal assessment and use that to guide the instruction on a day-to-day basis and have a system for monitoring how students are doing.
Okay, thank you. So those are all considered national best practices. I'm sure I'll get that question. We obviously have a teacher shortage. We're losing a lot of teachers as well out the back end. What I don't know if I heard you speak to what are you improving about the recruitment process for our teachers, and where are you looking for applicants? And are we being more attentive to recruiting from Montgomery County, including like Montgomery College and our very diverse high schools and elsewhere?
President Hucker, I can address that briefly, and then we can send some follow-up information to you as well. But our Office of Human Resources and Development has been working extensively not only to fill the immediate need, although we recognize it's not just Montgomery County, but a regional and a national shortage of teachers, but also thinking creatively about the work that we are doing to think strategically moving forward about how we recruit teachers. There is going to be information that's going to be shared as part of a Human Resources and Development presentation with the Board of Education next Tuesday. And so we can definitely share that information with you, and then we'll be happy to answer follow-up questions as well. But there's work going on for current shortages and then thinking strategically about moving forward. And yes, absolutely. Just to answer one piece of that, thinking about our high school students as well as our Montgomery College students, and what can we do to build that pipeline early on for people that are interested in being educators.
Right. Yeah, I doubt it will go away anytime soon. Also, do we know how many substitute positions are unfilled every day? And given that so many of our current teachers are subbing when subs aren't available, is there more funding to incentivize teachers to fill in as subs? I think we're paying around $15 an hour, you said, for absent teachers, but Howard County, I think, is paying about $55 a class. Can you talk about that and your approach?
So I don't have the data on the exact number of substitutes each day, but we can get that information. We have that in my email, but I don't have it right in front of me. In terms of the amount for the compensation for class coverage, that is something that is subject to negotiations with MCA. So I know there have been discussions.
Sure. No, I imagine they have ideas on this too. We also keep hearing about the loss of planning time from our teachers as well. I've heard from just neighbors about this, and lots on the listserv, and lots more through more official channels. How do you feel like you're addressing that issue?
So one of the areas that I think will have an impact on that is reducing the amount of quarantine instruction, because that's been a critical area where we know we want to meet the needs of the students who are in quarantine. But that's definitely had an impact on planning. And the other piece, which goes back to the substitutes is, we are continually doing substitute recruitment, substitute fairs. I know, I believe it was the last fair that we did a couple of weeks ago. We were able to recruit 15 more substitutes just through that fair that particular day. There's ongoing substitute fairs on a biweekly basis. And this is actually a topic of conversation that recently just came up in a call with at a conference with a number of other large school districts, brainstorming creative ways to increase the number of substitutes and ultimately reduce the amount of teacher coverage, while focusing on, at the end of the day, how we can preserve teacher planning time.
Okay, thank you. That's great. Councilmember Reamer.
Thanks. I think that's a holdover from the last.
Oh, I beg your pardon. I'm sorry if I missed you. Okay. If you don't have questions on this, just you go to the top of the list next time. Council Vice President Albornoz.
Thank you, Mr. President. You sort of touched on this, but staff are exhausted, just sort of across the board. They're really experiencing that on a lot of different levels. And so, having our teachers be in the best position from a social and emotional standpoint in their own right to be able to give the instruction that our students need is obviously going to be really important. Just if you can elaborate on some of the steps we're taking, and I appreciate the Herculean efforts that we are doing across the board from the administration on down to support the needs of our students. But I was just curious as to what specific steps we're taking to address the mental health needs of teachers and support staff.
So there are a couple of different ways that we are looking at this. Obviously, there's one approach, looking broadly at recognizing how dramatically the workload increased for this year, and looking broadly at what are the steps that we can take to best support teachers in either reducing workload or making adjustments to the workload, and at the same time working collaboratively with schools to share best practices across schools about what's happening within individual school environments to make sure that teachers feel valued and respected and supported, and that the work that they're doing is appreciated on a daily basis. And so we are continuing to have conversations. Again, some of these fall into conversations with MCA around, how we can best support teachers and looking at working conditions and workload. And then obviously we're continually thinking about what we're doing on a broader scale to best support all teachers and all school staff, recognizing the Herculean challenges, as you alluded to, of having, reopening all of our schools at 100% capacity, recognize that hadn't occurred since March 2020. There's also a variety of resources for individual support through our employee assistance program to teachers, and we regularly refer teachers and other staff to the resources that are provided there. We have full-time staff members that are part of the program. We also contract with an outside agency that is available for phone support 24 hours a day to school staff, recognizing that school staff are dealing with so much as a result of the work that they're doing on a daily basis, but also, for all of our school staff and for everybody on this call as well, or this meeting right now, many of our school staff are also dealing with things outside of school and balancing that. So how we can best provide supports to them and resources and people to talk to will benefit, whether it's for things outside of school or things in school, that will ultimately help them be able to be most present and meet the needs of our students best.
Thank you. I appreciate that. And then can you all describe a little bit, just if you can, the relationship with our State Board of Education? How is that working? And how is that influencing the decisions we're making here? Or, if you could describe a little bit that partnership, which I know for our public to understand is critically important, because we don't do everything in a vacuum here, and the decisions we make are often done in collaboration with our partners at the state level.
We have collaboration with the state level regularly on so many different topics. Just for example, one that we shared earlier today, the new guidance that was shared related to COVID-19 came from the State Department of Education and the Maryland Department of Health. And so, there was a meeting last week with superintendents and chief health officers to talk through what that guidance was going to be before it was released, and then to give time for school systems and local health departments to work together in terms of how that's implemented. In a variety of other areas, ranging from curriculum to instructional time to basically all the aspects of, the day-to-day operations of the school system, there's significant collaboration with the state in terms of how we, as MCPS, best meet student needs and comply with the laws and other policies that are in effect.
Thank you. I just want to acknowledge also our Board of Education, and I really appreciate their leadership through all of this as well, and the partnership and alliance. All of my colleagues and I have been in constant communication with all the members of the board on a myriad of issues throughout this entire time frame, and we stand ready to support you all in any way we can, and I appreciate this briefing. So with that, I yield back to you, Mr. President.
Thank you. Councilmember Jawando.
Thank you. Good to see you, Dr. Addison, and Ms. Hazel, as always. Mr. DeAndrea, thank you for all your work. Just a couple questions. I want to pick up where I think a couple of my colleagues, Vice President Albornoz, asked about this. And I see it every day with my kids' teachers. It's tough right now. We talk about the Great Resignation in the general populace. I think we're all very worried about that in context of education. So I appreciate the question about mental health, but I want to talk about the vacancies, just drill down a little bit. There's 325 or so, as I think I saw somewhere. And could you, one, confirm that that's the correct, and how many of those are full-time? What's the breakdown of positions? And what's the plan, realizing this is not just our problem? Where are we in making progress in reducing that number, which obviously will in turn reduce stress on teachers and not take lunches and planning time and all those things that are happening right now?
Absolutely. So the number that you quoted of 325, I believe that was a number as of about a week and a half ago. I don't have the updated number right in front of me, but I can definitely get that number for you. In any case, there are a significant number of vacancies that we are working very hard to fill. And in the interim, one of the challenges when we think about substitute teachers is a number of our substitute teachers are filling in as long-term substitute teachers in a number of these vacancies. And so ultimately then that has an impact on the number of day-to-day substitutes. And so we are continually working to recruit. One of the things that there's been a lot of work happening this fall is looking at the regional colleges and universities and looking at their December graduates. And so we definitely have some additional staff that will be coming on board as a result of graduating within the next 6 weeks or so, which will definitely help out there. But again, it's something where we are looking, right now at the current issue, but also thinking broadly moving forward. And, there'll be more details that are shared at the Board of Education meeting next Tuesday. And I'll make sure that you, all the council members, get a copy of that. And then I'm happy to follow up if there's additional questions, based on the information. But I will make sure that we get the current numbers to you as well.
I appreciate that. And I think just as we have the briefings with you, Mr. DeAndrea, you've been great. I think just that vacancy number, that's something we track in other contexts. I think it's something just on a regular basis that it would be good to know how that's going. And obviously, I know you're concerned about it. The Board of Education is concerned about it. We're concerned about it. The other is just I guess a question for Ms. Hazel and Dr. Addison or whomever wants to answer it. As you went through the slides, we see we know how real the learning loss has been, and then obviously the social, emotional, and just trauma that kids have dealt with and trying to acclimate to being in school, all the things that all at once that everyone's dealing with. There's my previous life, and you all are aware of this, there's always been a debate in education about how soon should we grade kids and how soon should we give them that A, B, C, D, E, or F, whatever the system is being used. And particularly for our younger students who have come back, I use the example of I have a second grader, and a fourth grader, but the second grader did half of kindergarten, was home for a year, then was online and is in school for the first time, regularly as a second grader now. And it can be demoralizing to kids who are behind to work really hard and do all the strategies that you're putting in place, and then they see a D or an F. Is there any thought being given to, in general, but specifically related to where we are now coming from the pandemic, realizing what has happened, to reevaluating those policies?
Yeah, that's a great question. We've had several conversations about grading and report cards during the pandemic, during the height of the pandemic, and even now. Certainly, we did make the decision at the elementary level not to give interim progress report grades because of that very reason. Students were just getting themselves back in. And so parents did not receive grades after 4 or 5 weeks in school. And so we will have our first set of grades that will come out very soon, in the next couple of weeks. We, at the elementary level, they don't receive D's and E's. It's a score of proficient, or at the primary levels, proficient or in progress. So I think that will allow parents to have some information about their students without it being too harsh, because we are very concerned about that. But we do have to balance the fact that students, we have had a disruption, and we do think it's fair that parents know where their children stand academically, but we also recognize that it is difficult for children socially, emotionally. But we made a lot of adjustments last year. Some adjustments we kept, just in terms of not so much the reporting, but how we grade students in the classroom, giving students more opportunities to retake, reassess, just kind of having more care and compassion about how we grade students in the classroom that will ultimately show up on the report card. And so we feel that making some of those adjustments in the classroom with teachers and the way they interact with students and grading is helpful, and we've continued those practices. But we did make the decision to go back to more traditional grading now that we're back. We haven't heard a lot of feedback from the public, but that is where we are now. And I guess we'll see once report cards come out in the next few weeks if we hear more.
Yeah, well, I appreciate that, and I know it's a balancing act. I brought it up because I know report cards are coming, and we certainly want to know where kids are, and we want to track and measure progress. And you don't want to sugarcoat that, but just how it's presented to them. And I think some of the strategies you described as far as retaking and the tutoring and all that will help. It's just something to observe about. Then just one other quick question. For those key moments in time, are there any interventions, for like reading at third grade, a key moment in time for students, right? There's others in middle school and high school level. Are there any specific interventions you can mention that you're putting in place in those kind of key transition points?
Well, certainly third grade is a huge area that we are watching. And when we think about it for any child, but let's just take third grade, it's been some time, first grade, since they had a full year of being in a building. And so certainly we saw grade 2 data, but we could say the same. Those grade 2 students are now in grade 3. And so we know that we really want to make sure that we are implementing those foundational literacy skills, more phonics, phonemic awareness, decoding, all of those skills. We're training our teachers and our teacher leaders to use, and building in more time in the instructional block, and buying more resources for schools to use to teach those skills. So that's really critical, but we are also monitoring those transition grades as students go from 5th to 6th and from 8th to 9th. And so those are really critical areas where we are watching at the district level, but then also schools, counselors are really helping to monitor those students, making sure they have a smooth transition into those new schools and new levels.
Okay. I appreciate it. I know this will be an ongoing conversation. I appreciate all the work you all are doing. Thank you, Mr. President.
Thank you. Yeah, indeed, an ongoing conversation. We look forward to talking a little bit more about this next week. And I'm glad to hear about all the interventions. It's sad that so many of our children are falling behind, and I'm glad to hear about the individual interventions and the focus on innovation. I really feel like, you know, in the past, there's always been broad programs that are accessible to different cohorts of students, and each one in this context, I feel like needs an individual plan, sort of like an IEP, but you know, addressing their learning loss individually that we can measure over time and know, and so each parent is assured that their child is getting the attention that they need, and not just part of a larger program and part of a number in a much larger system. We hear that a lot, and I think that would make a big difference. So I'm glad seems like we're moving in that direction. Okay, well, thanks to all of you for all your time. I know Ms. Hazel needs to go at 5, so trying to get out of here by 5. Thank you all so much.
I had.
Oh, I'm sorry, Ms. Navarro. Sorry, Councilmember Navarro, please.
Yeah, I'll be brief, because I do understand that there is a Board of Education meeting next Tuesday. So in my previous request, we can just do it for the Tuesday after that. That's fine. And maybe during that particular presentation, I would be curious also in terms of some planning ahead with possibilities of extended day, or, we did have a very successful partnership with the Rails Foundation for the Bell program. Are there already plans to start thinking through some of those types of additional interventions, either extended day, extended school year, and because of course, when we look at these numbers, I mean, they are disheartening, and there is no way to sugarcoat this. I mean, we knew this was going to happen because this was just so unprecedented, and our families and our teachers and everybody has worked extraordinarily hard. But this is what I was afraid of, and so now it's up to us to figure out how can we best handle the situation. So when we do have that update, like I said, not next Tuesday, but the Tuesday after, because I understand that there is a Board of Education meeting, it would be awesome to hear a little bit about what are some of those additional interventions that you may be thinking about, because some of them could require re-engaging with some of our philanthropic partners to see whether there are opportunities to scale up some of those best practices that we've had in the past, that have been, extraordinarily successful in helping our students.
Thank you. Anybody else want to get in here? If not, Mr. DeAndrea and Dr. Addison, Ms. Hazel and Ms. Dublinsky and Mr. Davis, thank you so much for all your help. Dr. Bridgers, thanks for hanging in there with us. I know we all learned a lot today, and we're looking forward to talking to you again in 2 weeks. Thanks for all your good work.
Thank you very much. And Ms. Izzard is here as well.
Ms. Izzard, I'm sorry. Yep, you're up the top. Everybody's squares are moving around, but thank you so much for all your contributions.
Thank you. Have a great evening.
Thank you. You too.
Get a flu shot if you haven't gotten one yet.
Just signed up today, Dr. Bridgers. I'm on it.
Thank you so much.
All right. Now we can move on to item 9, legislative session day 30. Item 9 is the introduction of Bill 4021, Individual Water Supply and Sewage Disposal Systems Amendments. So without any objection, that bill is introduced. And then for item 10, we have 2 bills for final reading. Item 10A is action on expedited bill 3021, landlord-tenant relations, restrictions during emergencies, extended limitations against rent increases, and late fees. This was tabled. I have to call for a motion under Council Rule of Procedure 10B to take consideration of expedited Bill 3020 from the table. Is there a motion from one of the council members who voted in favor of tabling the bill?
So moved.
Council Vice President moves, Council Member Navarro seconds. Terrific. Is there any discussion of this? Councilmember Tawanda?
No, not on this, on the bill.
Okay. On this motion. Okay. To all those to take it from the table, please raise your hand. That is unanimous among those present.
Aye.
Terrific among all those here. Great, all of us. And now, any discussion on the bill? Councilmember Tawanda? Do you want to? You're muted, I think. Sorry.
I was saying, Councilmember Reamer can go first.
Councilmember Chairman Reamer, please jump in.
Thank you. Okay, thank you. Well, last time we went through the Fed Committee's recommendation, which is before the council. And so we're here today to address the bill and hopefully pass one. I won't make extensive comments, but I'll just briefly rearticulate my view that the pandemic has gone on far longer than we anticipated when we first passed this bill. And I think it makes sense to extend the effect of this bill. So that's why I supported it. And I think we're seeing evidence out there that it's needed. Councilmember Tawanda has been working closely with council members. And so working with Councilmember Tawanda, I am going to move an amendment to the legislation. Again, this is a motion I'll be making in dialogue with the benefit of dialogue with Councilmember Tawanda. So I appreciate the opportunity here that we may have to come together to a unified position. And so in that spirit, the motion is to take the Fed Committee's recommended version and to change the date of effectiveness. So it's a little bit different than what's in the packet. The packet had these options 1 through 6. And option 6 did not rely upon the Fed Committee's recommendations around late fees. And that was a complex issue that we worked through, and I think we came to a good place. So I want to move that we'll keep the Fed Committee's recommendation with the addition of changing the date of expiration from August to May. So my understanding there is that that will take it obviously from 9 months to 6 months, and with Councilmember Tawanda, hoping that is a compromise that will bring the council together. So I will also move the DHCA clarifications to the Fed Committee on this specific issue. There is some red line in the packet where DHCA has, I think, specifically wanted not to have to adjudicate disputes over eligibility for the late fee waiver. So I move that all together. The Fed, the Fed Committee's version is what's before us, but the motion will be to change the date and to add the DHCA clarifying amendments or specific amendments, and then have that would be the amended bill before the body. So I move that.
Second.
Great. Okay. Any discussion, Councilmember Navarro?
Thank you, Mr. President. So I wanted to thank the co-sponsors as well as all my colleagues, because I think everybody has in their intention the willingness to figure out how do we continue to provide the most important kind of supports to our residents And how do we continue? I mean, this has been a theme today, right? How do we continue to shepherd this pandemic as we're trying to figure out this light at the end of the tunnel? What is that going to look like? And there's been lots of committees that have been put together to figure out all of the different components. I mean, we just had this briefing on the education loss, the learning loss, and we understand that this pandemic has affected every single area of our lives. And so I was, I was attentive to this notion of how do we do this in an equitable way. We've been talking so much about equity, and so there was this, conversation about how can we target this. And I myself started to look at some possibilities. Could we use the zip codes that were most highly affected during the pandemic, chronically affected, which is what we use to put forth these the Latino COVID-19 initiative, as well as the African American COVID-19 initiative. We use those zip codes, we targeted, et cetera. Could that be a way to be targeted, because we wanted to be equitable? And it was not a perfect way of doing it, because there were some zip codes that did not quite fall into that neatly. There were some other conversations about, some of our central office staff then started looking at, okay, what about if we use a metric around the type, the amount of rent that people pay, so we can get to the most vulnerable, et cetera. Again, very complicated way of doing this. Then there was the attestation conversation, and the idea of a report. And, I appreciated that thought process. I was always a bit bothered by the fact that we were putting the onus on the renters again, especially the most vulnerable, thinking that folks would just, go through that process, et cetera. So in other words, there was no real easy, in my opinion, clean-cut way to get to the goal, which is to be able to provide some support for folks who are still disproportionately affected by this experience. I mean, we are not out of the woods yet. We're not. We're getting there. We're very close, but we're not there yet. And I keep, thinking about when Mayor Bowser announced in, I think it was April, that the shutdown in the city would be until like June. And I remember thinking, oh my God, that seems so extreme. Like, it's just so long. Really, like, here we are still dealing with this. And so we cannot ignore the fact that we're still in the throes of this pandemic, that things are beginning to look up, but that there are people who have been extremely affected. Today we heard testimony when we were talking about the guaranteed income pilot of folks who have been deeply affected. And like them, there were so many who are in the shadows. We know that. We talk to these folks all the time. And so because of that, I think that this particular compromise, I think it's very doable. And it maintains, in my opinion, it makes us stay true to our values, which is what has guided all of our work during this crazy time. So again, I appreciate everybody's intentions. I understand also that there have been a lot of conversations about, what will this do to property owners, et cetera. And, we need to stay the course in making sure that the administration does provide and manage and administer the rent relief program in the way at Fidelity, like we envisioned this. This is really important too, because we understand that property owners and managements, et cetera, they also have to maintain their properties, they have to pay their bills and all of that. So it is a balancing act, and I understand that. But I think at the end of the day, we are all just trying to make sure that we get everybody through. So with that, I appreciate this compromise, and I will be supporting it.
Thank you. Councilmember Jawanda, do you want to get in now?
Yes, please. Thank you. Appreciate it. I'm
Sure.
glad Councilmember Navarro went first, but I appreciate the support. And usually the number one rule is you don't, negotiate with yourself here, but I don't think that's what happened. That's what happened to Councilmember Reamer's point. This was something that evolved, and I have been talking with, I've spoken with every council member about this proposal. And, normally you wouldn't, I'd much prefer the bill we passed out. I prefer the bill I'd introduced. I compromised in Fed to add the late fees attestation, Councilmember Reamer's amendment, and compromising again. So it's really kind of round three. And I think everyone has the right intentions here of wanting to help our most vulnerable residents. It's as always, it's a question of how best to do it. And I think this is the simplest, cleanest way we are in the pandemic. I had to turn my camera off earlier today during the testimony. There was some very emotional testimony from our residents who are severely impacted. And I know we all hear from them. To Councilmember Navarro's point, there are thousands of residents of the more than 11 million nationwide who are behind on their rent. In the state of Maryland, that's average about 5,000 behind. In Montgomery County, we know the average payment for the rent relief is over 10,000 of the average award. So we have significant issues here, and we need to make sure we not let that get out of control as we're working to recover. Give people some consistency and some stability. I'm glad we'll be able to do something on late fees here so that those don't continue to stack up for folks who are furthest behind and have had income loss. And so I think this is a good compromise. It will go till May and provide that level of baseline without overcomplicating it. So appreciate colleagues who I've spoken to about this. Appreciate Councilmember Reamer for proposing it, making the motion, and Councilmember Navarro to this point for supporting it. So thank you, and I hope others will as well. Thank you, Mr. President.
Thank you. Council Vice President Albornoz.
Okay, well, first, thank you, Councilmember Jawando, for introducing this in the first place. As everyone has stated, and as we all know, we continue to receive constituent calls, and both the volume and depth of need that's out there is still very much alive, and that's why we are moving forward with the Universal Basic Income Initiative. That's why we have passed record numbers of rent relief. That's why we've enacted the policies that we have and the support that we have for residents that are critically in need. We've done incredible work in the food security space and in a lot of other areas, because we have to do what we can to get us to the other side. And all of us at this point have dozens of heartbreaking stories of conversations we've had with residents recently that dictate we have to continue to take this seriously. But we also have to balance that with the practical realities that were brought to our attention after the introduction of this, that we have a wide range of property owners here in Montgomery County, and we are facing challenges, particularly with older buildings, on practical issues such as deferred maintenance. And I think by and large, our property owners have been good partners and good stewards throughout the pandemic. And while there have certainly been cases in which there have been problems and challenges that we've worked on addressing, I think on the whole, as a community, we have all stepped up to try and support each other during this unbelievable time of need. And so I think this compromise makes sense because it is a clean way of us continuing to address the very real need that's out there, but acknowledges that we can't do this in perpetuity, that we as we transition back, we will continue to provide support in all the myriad of ways that we provide it, but we also have to make sure that we address the practical issues, as I said before, like deferred maintenance, that are a challenge, and that if left unattended to, could create more problems for properties that end up costing more for renters in the long run. Because it will cost more to fix those things that right now a lot of properties are not in a position to be able to address in the way that they need to. I shared this the last time we spoke about this issue, but as the director of the Recreation Department, I was responsible for managing over 40 properties in the county. And during the recession, we literally had a broke fix strategy because we didn't have the resources on hand to address issues from a preventative maintenance standpoint. And so we were letting things break, which ended up costing a lot more than if we had prevented them from breaking in the first place. But property owners are compromised right now, not all of them, but some, in their ability to address those issues. And so I support this measure, acknowledging that it can't be done in perpetuity. And so we will continue to support our residents and our property owners in a variety of different ways moving forward. But I do think this is another important step to help residents get on the other side of this. And I think we have fared better than most other jurisdictions in that regard. When you look at the recovery that we've had here, we are faring pretty well as compared to a lot of others. So I appreciate the work that was done collectively behind the scenes to try and arrive at this place. None of this was perfect. All of it has pros and cons, but I do think this is the best path forward at this time. So I will be supporting this amendment, but acknowledging this can't be done in perpetuity. And I look forward to any further discussions we may have. So with that, I yield back to you, Mr. President.
Thank you, Councilmember Glass.
Thank you, Mr. President. And, you know, we all recognize that over the last 18 months, the best place for people to be to protect them from the pandemic is in their home. And we've been doing yeoman's work to make sure that people are able to stay in their home, starting more than a year ago with the $2 million that we appropriated for rental assistance. That has now grown to more than $100 million, thanks to our partners in the state and federal level as well. And we just need to have a all hands on deck approach because there are different needs for the vast number of people who are living in Montgomery County, especially our renters. And so I too appreciate the sponsors, council members Jawando and Reamer for putting this forward, and the consensus point that you have reached. And I do support it, but we know that there's more work to do. And as has been alluded, not every landlord is the same. There are quite large corporations doing this work, and there are mom and pops who invested their livelihood in an investment property. But I'll just share this one story that because of the procedures that we had taken last time, I didn't get to speak. But what I wanted to share was a personal story that a month or so ago, I was walking in East County along Greencastle Boulevard, and I was talking with residents there, and one resident, a woman, told me that in the last few months, while her rent hasn't changed, she started being charged extra funds because of the location of her apartment. That she lived in a modest 4 or 5 story walk up, and she was being charged $20 extra a month because she happens to live on the 2nd floor. And I engaged with her about this, and it was a fee. It wasn't a rent increase. And so we need to figure out how people are able to continue surviving and living here in Montgomery County, included after we pass this, right? And so there are more conversations that we have to have. Again, not recognizing that not all landlords are the same. But it speaks to the various needs and the various experiences that our residents and most vulnerable residents are experiencing. So I will support this, and we can have future conversations as necessary, but the best place for people to be during a pandemic is safe in a home. And I know that we're doing this with this bill, with this extension, we're doing it with the rental assistance. And while that funding is not being doled out as fast as we would all like, and we've all shared our collective voice on that, more than half of it is, more than $55 million at this point, has been doled out. And so the work continues. And so with that, thank you, Mr. President. I yield back.
Thank you, Councilmember Katz.
Thank you very much, Mr. President. As I begin, if you could please make note that I too was supportive. I wasn't here for the vote to take it off the table, but if you could please record my vote that I was.
If the clerk could record.
Let me begin by thanking Councilmembers Jawando and Reamer for this as well. I certainly thought, as Councilmember Jawando will remember of our conversation last evening, I was of the belief that the suggestion that Councilmember Friedson made, I guess it's 2 weeks ago already, that was going to get more relief for more people who were in need. And because that's what this is all about, is to try to get relief for people in need. And I've been going back and forth. I listened to Councilmember Jawando and Reamer and others on this issue. And candidly, there has never been a compromise that's perfect. and neither is this one. Having said that, I do believe this compromise is probably the best that we can come up with to keep as many people whole, both as Councilmember Navarro has mentioned, both from the renter side as well as the landlord side, because funds have to be there in order to keep things going. But I do believe that this is probably the best compromise we can come up with. I applaud Councilmember Juando and Councilmember Reamer for working through all of this and others. And so that I too will be supportive. Thank you. And I yield back, Mr. President.
Thank you. I hope the clerk got Councilmember Cass's vote to take the motion to take the bill off the table. Councilmember Juando.
Thank you. I just wanted to say briefly, thank you to everybody, each of my colleagues, particularly thank you to Councilmember Reamer for his help and work on this compromise. I think Councilmember Katz put it well. There is no perfect compromise, but this was an example of that, and I think coming together. And just a reminder that you can still increase rent, but just to the guideline. And so trying to balance that out, the concerns that Council Vice President Albornoz raised about deferred maintenance and others, those are real, particularly for small landlords, and I've spoken to them as well. And so I think this strikes as good of a balance as we can right now. Also appreciate Councilmember Glass bringing up the point about the fees. It's something that I've been hearing about too, as another way. I told the story of Katia and her son last week who almost was going to have to move because of $70 increase. But if you have a $40 fee increase, that matters too. So there's a lot of things we need to look at. And again, not most landlords are doing the right thing. But when you have a county as big as ours, even a 1% problem is a problem for thousands. And it's not something that we can allow. So really appreciate the work, and just wanted to particularly thank all my colleagues and Councilmember Reamer for working through this. Thank you.
Thank you. Councilmember Friedson, sorry if I skipped you earlier.
No problem. Thank you. A couple things. One, I had obviously preferred a different approach, one that I think would have been more equitable by targeting the support to those and the relief to those who actually need it. This has been framed as an emergency measure, and so it would seem reasonable to focus this to the people who've actually been impacted by the emergency. There are real significant unintended consequences of rent control in virtually every place that it's been tried. It has shown some of those unintended consequences, and it's not just related to landlords and deferred maintenance, as has been discussed here, which is real and is significant. We want to make sure we have quality housing stock here in Montgomery County and adequate housing stock in Montgomery County. It also tends to hurt some of the very people that it's intended to help. It promotes condo and other housing types instead of rentals. It increases the cost on new residents. So we want to be a welcoming place. You look at certain places with significant rent control, the cost of new housing is really expensive. And so there's an equity issue with a county that is getting more and more diverse with more and more new residents. The people who are paying more are the ones who are coming here new and signing new leases. The people who are doing better and get the sweetheart deal, so to speak, are the ones who have been here for a long period of time. So I do remain very concerned about that. I do think it's something that we really need to focus on. I recognize that this was put in place as an emergency measure. The effort here is to extend it a little bit to create some level of a buffer, whether that was a 90-day buffer or a longer buffer here with 6 months beyond that, I think is a reasonable approach. But I do think that the targeted approach was the better way to address this. With that said, I think these are two very different amendments personally, and I do think it would be appropriate if it's to the, the council president and the sponsor are willing to separate the two amendments. One is related to the DHCA requests that I think are more substantive than have been presented, and the other is about the timeline. I'd be more comfortable if the amendments were separated out, but of course it's up to the will of the council president and the sponsors.
Okay. Sponsor the amendment.
Okay, so procedurally, that means that you want to have a separate vote just on the DHCA amendment?
Yes, I would prefer that if it's amenable to you.
So it's not the Fed version with the Fed recommended late fee. It's just the DHCA additional
Fed
language.
recommended late fee, my understanding is that's part of the committee recommendation.
Right.
You're presenting
That's what's before us already.
to the committee recommendation, one to change the date, to 6 months as opposed to a year, which was the committee recommendation. And the other is, which will be found, I believe, in the packet on pages 88 through 90, which were the DHCA requests. I'd prefer to take those up separately because I think they're different issues, and I would be voting potentially differently on the two of them.
I mean, I don't object if council members want to have separate votes. If I don't think it's going to change the outcome, and I think it will certainly prolong the discussion. So, but I appreciate if you want to cast a different vote there. So I don't object to separating them. It's fine.
Okay. If you're fine with that, and Councilmember Friedson has suggested that, Ms. Wellens, could you describe the two amendments just so everybody's clear in the public?
Certainly, Mr. President, and also just procedurally. So I think that it might be that you would want Mr. Reamer would withdraw his pending motion and make the new motion for each amendment separately. So the First Amendment is fairly easy to describe. So this one would take the Fed version of the bill, which is at circle 1 of the packet, and it would make one change, which is simply to have the end date for the limitation on the rent increases and the late fee relief. The end date of that would be May 15th, 2022, instead of August 15th, 2022. So that's the First Amendment that was discussed. The second set of amendments relate to feedback that we received from DHCA. And as Councilmember Friedson stated, there is a red line, I believe it's at Circle 88, to show those amendments. And they do two things. One is that for the requirements for qualifying for the late fee exemption, alters those slightly, takes one of the criteria away, which was that the renter would have had to owe at least $1,000 to the landlord in order to qualify for relief from the late fee. So that would be struck. And then the other change would be that there would be a provision added to the effect that the landlord may not question the veracity or basically look under the hood of the attestation, that the landlord would accept the attestation essentially, it's essentially an honor system. And that way there would not be complaints flowing to DHCA regarding whether an attestation is accurate, and would not result in the added administrative burdens of trying to determine, whether an attestation is correct or not. So again, Mr. President, I think those are the two separate groups of the two separate amendments that we're talking about.
So I can move the first, the change of date.
The change of date.
Second again.
Councilmember Jawando seconds. All those in favor of moving the change of date to the 15th of May, raise your hand.
Aye.
That is unanimous. Great. Okay. Second
Now I
one.
will move the DHCA amendments.
Second.
Okay. All those in favor of the DHCA amendments as moved.
Aye.
Can I just have a question? Can I just
Yes,
ask a question
Councilmember
real quick?
Navarro.
Ms. Wellens, you did say something about the HCA not questioning the attestation. What does that refer to now that we took the vote of just extending with no need to? Is there still an attestation needed?
So the attestation would just apply, Councilmember Navarro, sorry, your picture moved around on my screen. So the attestation would still apply in the late fee scenario. So
Okay,
the
got
Fed's
it.
version of the bill, had the,
Okay.
yeah, okay.
Thank you. Yeah, thank you. Great. Thanks.
Okay. With that clarification, all those in favor of the DHCA amendments, please raise your hand. That is
Aye.
Councilmembers Reamer, Hucker, Jawando, Glass, Katz, Navarro, Albornoz, and Rice. And all those opposed, Councilmember Friedson. Okay, that motion passes as well. So now on the bill as amended.
I'd move we pass the bill as amended.
Thank you, Councilmember Reamer. It looks like he's seconding.
Second.
Okay, Madam Clerk, would you please call the roll?
Thank you, Mr. President. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Jawando?
Yes.
Mr. Jawando votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes.
Bill passes. Congratulations. Good work. We're almost there. Okay, now on to item 10B. That is Bill 4520, Police Community Policing Data. The Public Safety Committee recommends enactment with amendments. I'm very proud of where we have gotten with this bill. Proud to be a co-lead sponsor with council members, with the chair, Katz, and Councilmember Jawando and Council Vice President. I think this is going to go a long way to improve the data collection we have and build the public confidence we have in our police and our police community relations. Very grateful to all the sponsors for their hard work on this. Council member, Chairman Katz.
Thank you very much, Mr. President. And I'll try my best to be brief, and I'm going to ask Ms. so I won't repeat what went on, but we had 4 work sessions on this, 3 that were strictly the Public Safety Committee, and 1 that was the Public Safety and HHS Joint Committee. We worked through many different discussions. It was robust discussions, but the purpose of the bill is to define the term detention in the county's community policing law, how to track and report on data on street stops and field interviews, how to survey residents and staff on police community relations, how to build capacity to use policing data to advance best practices in constitutional and community policing, how to collect and report race and ethnicity data for every policing data set, and how to have additional policing data on Data Montgomery that aligns with internal data sets, including data on criminal and civil citations. I'm going to ask Ms. Wellens to go through the specifics of the bill, but we did a lot of work to get where we have gotten, and I'm sincerely appreciate everyone involved with this. So, Ms. Wellens, if you could please lead us through what went on.
Thank you, Mr. Chair. So this bill, as everyone will recall, stemmed from a report of the Office of Legislative Oversight and the hard work of Dr. Elaine Bonner-Tompkins regarding best practices for collecting and making transparent data related to community policing. And the original bill kind of divided, and still the existing bill divides the data into two basic categories, one being data that's going to be reported annually to the county executive and county council by the police department. And the other is data that will be posted online more in real time by the police department. And again, these are all data points that relate to police community interactions and are broken down by demographic information, including race, ethnicity, gender, age, and a range of other factors. As you said, Mr. Chair, there were 4 work sessions in which numerous amendments were considered and adopted. And I will just tell you the main kind of premise behind the various amendments was to really look through and take into account the state laws, changes to state law that happened after the bill was originally introduced, to incorporate recommendations of the Reimagining Public Safety Task Force, as well as Police Advisory Committee recommendations, and to incorporate a number of community advocate recommendations and best practices. And through that, working also very closely with the police department and the chief and his staff to make sure that the amendments were practical and made sense, both internally and also from a community perspective of what information will be really valuable to know. So, and I'm happy to answer any questions about the specifics of it, but instead of just listing the different amendments, that's the background for it. Thank you, Mr. Chair.
Thank you, Ms. Wellens. And with that, Mr. President, I'll turn it back to you unless you have questions, please.
I have no more questions, Mr. Chairman. Any other comments on this bill? Councilmember Duranto.
Yes, I'll be brief. I know that the hour's late. We earned our checks today. I just wanted to mention and thank everybody. Thank the community. I think Ms. Wellens, your point was spot on there.
Yep.
Dr. Bond. Oh, can you hear me? Oh, Dr. Bonner Tompkins, Natalia Carasosa, who worked on the OLO report that I requested after. I think it's important to put everything in context. So much has happened in the last 2 years. We started digging into this when we had the young African-American men stopped at the White Oak McDonald's, who were none of whom were arrested, but were all issued trespass orders. And Councilmember Rice and I met with one of those young men in our office who got very emotional and talking about how he had been trespassed from that McDonald's, but also from a 7-Eleven across the street, and had never been arrested. And subsequently worked for Jacob Newman at our great Civic Center, checking people in, and is doing well today. That incident became noticed because in that interaction, one of our police officers used the N-word in connection with this stop, which again yielded no arrest, but trespass orders. And when I was shown one of the paper trespass orders, it didn't collect race and ethnicity. And when I asked how many had been issued to people and where and which district, I was told they were kept on paper copy at each individual station. And we didn't know any data or relation to them. So we started digging deeper and asked for this report, and we saw that there are many things we're just not tracking. Whereas New York's been tracking for 20 years who stopped and frisked, we don't track the race and ethnicity of who stopped and frisked, so we previously hadn't. And you can't improve community police relations, and you can't improve community practice if you don't track, and if you don't use it to improve and to know what's happening. Disparities happen over a large period of time, over a large data set, and you have to have the data. And so I really want to thank the police department. And I know I saw Assistant Chief Frank for their constructive feedback on several of these measures as we worked through on the Public Safety Committee, which I'm an adjunct member now, Councilmember Cass, of worked through this bill, and then to the HHS Committee. This is going to really help, I think, improve practice in a big way. And I want to thank everyone who co-sponsored, all the co-leads, the entire council. and thank Councilmembers Navarro and Rice, because this builds on, this will actually giving us something to amend. We're amending their community policing bill by adding these things into it. So I want to thank them as well. And, you know, we're going to get there. This is going to help us look in a critical way and improve practice and make sure everyone feels safe and protected in their communities. And I think this will go a long way. So just wanted to say that and really appreciate the ability to make a couple comments. Thank you, Mr. President.
Thank you. Good work. Chief Frank, Lieutenant Satinsky, anything to add here? Are we all good?
No, I thank you for collaborating with us, and it is a work in progress. We're working very hard, as we've discussed in our many work sessions, about our new RMS system and digitizing, finally getting away from paper after many years. So we continue to work at it, and we appreciate the joint effort.
Great. We should have you consult with the medical community. Okay. So if that is all the comments today, Madam Clerk, do you mind calling the roll, please?
Mr. Glass,
Yes.
Mr. Glass,
Yes.
Mr. Glass votes yes. Mr. Joando,
Yes.
Mr. Joando votes yes. Mr. Reamer,
Yes.
Mr. Reamer votes yes. Ms. Navarro,
Yes.
Ms. Navarro votes yes. Mr. Rice,
Yes.
Mr. Rice votes yes. Mr. Friedson, Mr. Friedson votes yes. Mr. Katz,
Yes.
Mr. Katz votes yes. Mr. Albornoz,
Yes.
Mr. Albornoz votes yes. Mr. Hooker,
Yes.
Mr. Hooker votes yes.
Great. Thank you. That bill passes as well. Okay. Finally, item 11 is an action on a resolution to extend the expiration date until January 21st, 2023 for expedited bill 3420, police disciplinary procedures, police labor relations, duty to bargain amendments. Is there a motion to approve this resolution?
Does it need a motion, Mr. Council President? I believe it's for.
I think so.
Maybe it doesn't. I had my notes asked for a vote. Okay.
It does need a motion.
So moved.
And I so move. Yeah.
Okay. Councilmember Reamer moves. Councilmember Katz seconds, it sounds like. All those in favor, please raise your hand.
Aye.
Aye.
Councilmember Rice, you're on board.
And Reamer as
Aye.
well.
And Reamer as well. Right. Okay.
Rice and Reamer. Yep.
Yes. Okay. All right. That bill is extended. Any other comments, complaints for the good of the order? Okay. Good work, everybody. Good day's work. Thank you. Have a good night.
Information to aid you in your daily commute. Montgomery.
Travel slow on Interstate 270 in the following locations. Northbound